Hello, good afternoon, everybody. Good evening for some of you. A very warm welcome to this webinar on managing and monitoring air quality in Ortigas. My name is Karma Yangzom. I am the Principal Environment Specialist in the Sustainable Development and Climate Change Department of the Asian Development Bank. And I also serve as sort of the focal for air quality and air pollution issues in the department. So I will be moderating the webinar today. And actually today is more of a training. So this is really our fifth air quality webinar. We began back on 7th September. So ADB has been organizing a series of webinars on air quality. The first one was held on 7th September to celebrate the first International Day of Clean Air for Blue Skies. And then following that, we had some other webinars that were looking into linkages between COVID-19 and air pollution and co-benefits. So it was a range of topics that had been covered in the past webinars. Today's webinar is a little bit unique and different, where we are discussing more on the indoor air quality management. And this webinar is, which is a training actually, this was organized in response to a request that ADB received from the Ortigas Center Association to organize a webinar on air quality. And I would really like to thank OCAI, that's the short form of the Ortigas Center Association Incorporated. I would really like to thank OCAI for giving ADB this opportunity to organize this webinar. It's a very, very important one. And it's actually of immediate importance, particularly in the context of, the pandemic, and with the lockdowns getting more and more relaxed. And we are right now in GCQ in most of Metro Manila. And soon we may shift to MGCQ. And, as things get more and more relaxed, I think we really need to build the confidence of our consumers, clients, employees, to start going back into the buildings, into the malls for shopping and going out to eat in the restaurants. So this is very, very timely. And I think the discussions that we have today, this is something which is actually of immediate importance to us. And hopefully some of the knowledge that we gain today, it can be immediately applied into the buildings here in the Ortigas area. And I think most of the participants today are from our residents of Metro Manila. And as we all know, the Asian Development Bank is based in the Ortigas area. And we are also a member of the Ortigas Center Association. So we really hope to have some good discussions and get some good knowledge and experience and build the confidence of everybody in terms of, going back to the new normal. And you could be the building manager, or you could be the owner of a company, or you could be an employee, or you could be a customer going to shop in Mega Mall or Podium. So I think this webinar today is important for everybody. And I really look forward to the discussions. Before I begin, I would just like to remind our participants to please use your full name when you register, because we will be issuing certificates for all the participants that attend the training today, so that we can have a record of your correct name to put on the certificate. So if you can please do that, or alternatively, you could also just give your full name. You could message it privately to Christopher Tabungar. He's there as a host for this in the Zoom chat box. You could privately send him a message. So without any further delay, let's get on with the webinar and the training. And I would like to invite our first speaker for today. So we have Miss Glenda Bathan Batarina. She is the Deputy Executive Director of Clean Air Asia, and I'm sure everybody knows what Clean Air Asia is. It's a very important organization doing a lot of very important work in managing air quality. So Glenda has 20 years of experience in policy and program development for clean air, sustainable transport, industrial emissions control, and climate change mitigation. She helped draft the 1999 Philippine Clean Air Act, implementing rules and regulations. She led the Asia Clean Fuels and Vehicles program, which resulted in national policies for Euro 4 vehicles and fuels for Vietnam and the Philippines. In 2020, she was named one of the remarkable women in transport by the Transformative Urban Mobility Initiative. So, Glenda, it's a pleasure to have you on board. Clean Air Asia is a very close partner of ADB, so it's wonderful to have you on board. So I hand over the floor to you, Glenda, for your presentation, and if you can please finish in 20 minutes.
Thank you very much, Karma, and a good afternoon to everyone. I'm actually delivering this presentation on behalf of a colleague, Dang Espita, who is our program manager, but who couldn't join you today as she has fallen ill with the flu. Nevertheless, I wish to share with you some general concepts of air pollution and its management. Clean Air Asia is focused really on improving air quality in Asian cities. And our primary means of doing this is in three ways: informing for action, and through developing evidence base, trainings and workshops, which is how we conduct our capacity building, and providing policy guidance through science-based policy briefs and knowledge products. As you can see, we have worked all over Asia, and including in Mongolia, India, Vietnam, but we also do significant work within the Philippines. As you can see, we have helped in developing clean air action plans for cities across the Philippines, also helping them come up with the evidence to be the basis of their clean air action plans. And close to home is Pasig City. We're working with the city of Pasig and Philpost on coming up with sustainable transport solutions, including a pilot on electric three-wheelers that help bring your post sustainably. Now, why should we care about the quality of air that we breathe? They say that these are the basic needs that we need to survive. And we can survive with 3 weeks without food, 3 days without water, 3 hours without shelter. But 3 minutes without air, we wouldn't be able to survive that. And thus the real importance of having good quality of air that we breathe. Air pollution is the introduction of substances that can impact or harm our public health, safety, and welfare. And air pollution costs money and costs lives. So the sources of air pollution are stationary, mobile, and area. Stationary sources, these are industrial sources of pollution. And as you can see here, some photos include those of manufacturing facilities with polluting stacks. Mobile sources are actually motor vehicle sources. So all of the those that run on conventional fuels, for example, gasoline or diesel. But let's not forget that shipping can also be a big source of pollution, and as well as airliners. Area sources, these are sources which are are difficult to pinpoint specifically where the source comes from. So these could be small sources like cooking and grilling or construction. Now, there are several sources of pollution according to whether they are man-made or natural sources. So natural sources include, if you have any volcanic eruptions, then that would emit dust. And fires, for example, forest fires are natural examples of natural sources. Anthropogenic sources are man-made sources, such as from indoor cooking using biomass fuel, and industrial sources of pollution, and motor vehicles like this one, a smoke belching jeepney. Now, on indoor air pollution, so in many scientific publications, they make distinction between indoor sources and outdoor sources. So indoor sources of pollution include, of course, cooking indoors, appliances that combust fuel. So your cooking stove, if there is someone smoking indoors, then that can be a cause of pollution. Your cleaning products could also be causes of pollution. The materials by which your home is made of are indoor sources of pollution. And for outdoor sources, I think we're very familiar with these vehicles, our road, which is resuspended because of ongoing traffic, and other sources that are outside of homes and buildings. Now, within the urban areas, main sources of urban air pollution. So industry, transportation, buildings, so cooking, heating, and from and sources which are close.
I think we lost your slide, Glenda, or did we lose Glenda? Hello?
I think we lost Glinda. We'll just wait for her to reconnect.
Yes. Apologies, everybody. Let's see if we can reconnect. If it takes too long, then perhaps we can move on to the next. I think we should wait a few minutes first.
Yes.
So even if Chinky shows the presentation, Glenda is not there, no? So we have to wait for Glenda to come back. Oh, Chinky also lost connection.
Okay. Okay. Glinda's coming back in. I just admitted her. Okay, so she's back. Glinda, are you with us?
Hello, so sorry about that. I don't know what happened, but let me share my screen and get back to the slide I was
Yeah, no
starting
problem.
to.
It happens.
No worries.
Thank you. Okay. Are you able to see my screen now? I'm
Yes,
just
you
putting
can
it
put it
on
on the
slideshow.
whiteboard, yes.
Chris, can you see my full
Yes.
screen?
It's not. It's still in slide sorter view.
Thank you. This one is an important one Just off the press is the state.
Glenda, your connection is very patchy. Perhaps would it help if you turned off your video and just used like just
Okay.
maybe that will help.
Yeah.
If you can put your the PowerPoint is still on not on
Okay.
slideshow.
Hello. I hope you see my full screen now.
Yes.
Yes. Yes.
Yes, and maybe it will help if you can switch off your video and just use
Yes, let me do that.
helps
Oh,
with.
but if, okay, I'll do that.
Just a little hiccup.
Okay. Let me
Apologies,
see. Yes, let me
everybody.
stop my video.
Yes. Okay, go ahead, Glenda.
Okay, I hope there is a little bit of delay, but I hope you can see my
Yes,
screen
we
now.
can.
Okay, so this is an important slide. The air pollution is the fourth leading global risk factor for early deaths globally. And that's coming after high blood pressure, tobacco, and dietary risk.
Oh, I think we lost her again.
Yeah. Maybe Chinky can show the when she comes back.
Yes.
Maybe.
Chinky, could you show the slide, please?
Sorry, everyone. We're having some technical difficulties.
Karma,
Yes.
while waiting, I was wondering, since you haven't initiated a round of introduction, shall we do that or
I was thinking
wait and
save on time. I will introduce the speakers right before their presentation.
sure.
Uh,
Okay.
yeah, but then since we are anyway spending time waiting,
Yeah, we can also ask our participants if your videos are on, can you uh, close them just to save on bandwidth?
mhm.
I can see some participants having their videos on.
But that does not matter, no, Chris? I think it matters only for the one who is presenting, from what I understood.
Yes. Hi, Karma. Can you hear me?
Yes, yes, we can hear you, Glenda.
How would you like to proceed?
So, Chinky, can you please show Glenda's presentation from your screen, from your computer? Chinky?
Yes, I can do that. I'll
Thank
try
you.
my
I
best.
think that would really be helpful.
Yes.
And I can go quite quickly through the rest of the slides.
Mhm.
So as I was saying, air pollution really is considered the fourth global health risk in the world. And
Sorry,
this
I'll just go
is
through this.
no problem, Chinky, thank you. And this is out of an October 2020 report that was issued by the Health Effects Institute that is based in the US and issued the State of Global Air report. Can you go to the next slide, Chinky? Yes, so this is the one. This is important. So now the estimate is that in 2019, 6.7 million deaths were caused by or were related to air pollution. The most important pollutant that we should be mindful of is really particulate matter, 2.5. And why is this? Because PM 2.5 comprises of very small particles that can go deep into the lungs and can cause a whole host of diseases. Can we go to the next slide, Chinky? Yes, and as you can see, while mortality is, the worst effect of PM 2.5 pollution, there are so many other different impacts that we need to be mindful of, including illnesses, ER visits, etc. And much larger population is affected. And in the next slide,
If you are not speaking, can you please speak, turn off your mic, mute your mic. I can hear some background noise. Thank you.
if we can go to the next slide, Chinky.
Maybe there's a bit of delay again.
Yes, no problem. I will just, I suggest that you just click and I'll go through the slide based on your pace. So as you can see here, there's so many different causes of death that can be attributed to air pollution uh, um, uh, and illnesses as well. So diabetes has already been linked to air pollution. And what is actually surprising is that, and this can be confirmed by our doctors who are going to be in the panel later, is that even heart diseases are linked to air pollution. And so these are all the health and the environmental impacts that air pollution can cause. And that's why it is beneficial for us to improve air quality. And in the next slide, as you can see, there are several different types of pollutants, and the way that the government helps us minimize their impact is by setting national ambient air quality guidelines. And the World Health Organization also has set several guideline values to serve as guide to the governments. Next slide, please. So the most important message from this slide is that air pollutants and climate pollutants are basically come from the same sources. And so what is helpful for us to protect our health can also contribute to reducing greenhouse gas emissions and reducing the pollutants that have climate forcing impact. Next slide, please. So air quality management is the means by which we actually bring all of the stakeholders together to reduce air pollution. And we do this first by gathering the evidence of the pollution and targeting the mitigation actions to address specific sources. Next slide. So just, we don't have to go through this, but this is the framework by which Clean Air Asia helps cities to reduce air pollution in urban areas. And I'd like to go to the next slide to show a case study that we did in one city in the Philippines. So as you can see, this is a map of Marikina, and we helped Marikina develop a clean air action plan by first gathering the evidence of the sources of pollution through emissions inventories and measuring the quality of the air through monitoring, assessing the health impacts of air pollution, and all throughout the stakeholders were involved. Next slide, Chinky. And we can go quite quickly through these slides as these all pertain to Marikina. You can also see here that we partnered with several different stakeholders and organizations, including from national government, of course, from the city government, and private sector as well, and as well as universities to help us gather the evidence for the Clean Air Action Plan. And this is just a sample of what we can do by mapping the sources of pollution. So as you can see, the red spots are the spots along roadsides which produce the highest levels of air pollution. And when we found out, together with stakeholders, that many of these hot spots are actually close to places where vulnerable populations live and work, like close to an elementary school, our recommendations were maybe some of these terminals for tricycles and jeepneys could be relocated where there is lesser vulnerable populations like children or elderly reside. Next slide, please. So similarly, we are doing this also for Manila, for the city of Manila. The same thing, we gather evidence and then we will help them develop a clean air action plan. So we can go quite quickly through these slides. Just mindful that I'm 1 minute over time. So this is just the story that we can get from air quality monitoring. So we were able to capture in Manila City air pollution levels before the ECQ, during the ECQ, and the different levels of quarantine. And as you can see, towards the right-hand side, there is the trend is that as there is a lesser stricter quarantine level, that the pollution levels also start to increase. Next slide, Chinky. Okay, so these are all, the succeeding slides are all ways by which we are gathering evidence and providing information to the city and to the stakeholders. All of this, the purpose of all of this is to help the cities develop an action plan that addresses the primary sources of pollution. And so let me end my presentation here because I'd like to give way to the rest of the speakers to discuss with us a very important topic for the Ortigas Center Association, which is really indoor air pollution. So thank you, Chinky, for flashing all of these slides. But I'll hand this over. I'll hand the virtual podium back to you, Karma. And thank you, everyone. And I'm happy to answer questions. And so sorry for the glitches that we had to go through. Thank you.
Thank you, Glenda. No worries. I guess these are things which are really beyond our control. So thank you for that that overview, Glenda, and to our participants. So this is really to help to set the stage on the importance of air quality. And as Glenda had pointed out, that in the recent report from the Health Effects Institute, it's the fourth cause of death. Air pollution is the top fourth cause of death. So that is quite critical, and 6.9 million deaths in 2019. And PM 2.5 is one of the main air pollutants which contribute to these deaths. So I think these are all very important messages, and also the work that Clean Air Asia is doing within Marikina and other parts of Metro Manila in partnership with different stakeholders. So that is very heartening to know. So now I would like to open the floor. Does anybody have any questions for Glenda before we move on to the next presentation? The next series of presentation now, we will really be narrowing down indoor air quality and then looking into the health and safety standards inside buildings. But before we move on, does anybody have questions? You can either post it in the chat box, or if you want to speak up, you're also welcome to do that. I take that as no questions for now. So in that case, let's move on to our next speaker. So I have the pleasure of inviting Dr. Victorio B Molina. He is a professor of environmental and occupational health in the College of Public Health in University of Philippines, Manila. He holds degrees in civil engineering and environmental and sanitary engineering, licensed to practice both professions in the Philippines. He has a Master of Public Health from the University of Philippines, Manila, and a PhD in Environmental Science from the University of Philippines, Las Baños. He writes a lot of international journals, mostly in the areas of water sanitation and hygiene, health risk assessment, air pollution, healthcare, waste management, and hazardous substances. He also provides technical assistance to government agencies, industry, and non-government organizations on various aspects of environmental and occupational health. So, and one of his main advocacies or passions is to promote environmental health in the Philippines and in the Asia-Pacific region. So, Dr. Molina, welcome, and I hand over the floor to you. And I see that there is one question, what mitigation measure? We'll come back to you after Dr. Molina's presentation. Please, Dr. Molina.
Okay, isang magandang hapon po sa atin lahat. Now, good afternoon, everyone. I would like to thank, in a very special way, the organizers of this very important webinar, CCA, Clean Air Asia, ADB, and ACAI. Thank you so much for inviting our institution, the College of Public Health, UP Manila. We fully believe, as an institution, that your webinar this afternoon is not only very important, it's also very timely. And as shown in the earlier presentation, clean air or air quality is one of the most important determinants of health. And we also note in the earlier presentation that the quality of air is somewhat related or proportional to human activities and urban development and including industrialization. So I think one of the basic foundation of my presentation this afternoon is the first law of ecology. As most of you remember, there are 4 laws of ecology. And the very first law, the very first law of ecology states that everything is connected to everything else. So a little later, we will discuss that the discussion of Clean Air Asia regarding the air pollution in general will also have a potential impact on air quality, plus other activities within the workplace. Now, this will be the objectives of our session this afternoon. After the 20-minute session, we expect all the participants to have a practical understanding of drivers of indoor air quality, to talk a little bit on sick building syndrome and its impact to workers' health, some information on guidelines in the workplace to ensure public health safety in the new normal, and finally, a little bit on monitoring. So at this point, perhaps I would like to show a short video as an introduction to my session.
Chinky, over to you. The volume.
Kindly increase the volume, Chinky, please.
No volume still, Chinky. Pinky, did we lose you?
I'm just here. There.
It's the 21st century.
Yes.
We live in a whirlwind of technological advancement. LED light bulbs, self-driving cars, buildings as tall as mountains, even computers that think. Yet with all this technology, we replace this with this. The average American spends 90% of their time indoors. Think about it. Buildings are becoming ultra efficient, highly insulated, and what happens is the dirty air is trapped in and the fresh air gets locked out by design. And because of this, it becomes extremely difficult to focus on your work. Poor air quality is very uncomfortable. Recirculated air in a building can become toxic. They even have a term for it. It's called sick building syndrome. It can cause chronic headaches, fatigue, sickness, and it's estimated to cost industries over $60 billion a year due to people missing work and reduced productivity. So, how does this happen? Let's break it down. Air is mostly made up of nitrogen, oxygen, argon, and carbon dioxide, or CO2, which is only 0.04% of the total volume. Even small amounts of CO2 can negatively impact your ability to think and function. Have you ever had to read a sentence 2 or 3 times to understand it? You were probably in a closed space with potentially poor ventilation. Your exhaled breath is made up of high levels of CO2, which means the more people in a room, the more CO2 in the air. The average student, they breathe about 220 balloons full of air in the typical school day. That's over 6,000 balloons in one classroom. This creates 5 times as much CO2 as fresh air. And all of that dirty air is then recirculated in your standard air conditioning system. Every year, over 14 million school days are missed because of asthma, which is directly tied to indoor air quality and mold. That's equivalent to the entire student population of Wyoming missing school every day for an entire year. So what would happen if instead of breathing this contaminated air, we brought in the perfect amount of fresh, filtered, perfectly conditioned outside air? One study shows that a reduction in CO2 doubles a person's brain function. Healthy buildings can reduce respiratory illnesses by up to 76% by balancing humidity and improving circulation. These simple changes can cut down on airborne diseases and allergies, reduce microbial activity, and prevent the buildup of mold. Healthier indoor air makes a huge difference. Not only does it make us feel better, perform at our best, it creates an environment worthy of the 21st century. Imagine the impact it can have on everything. With a highly effective, dedicated outdoor air system, this transformation can save you millions and cost as little as $1 per person per year. Let's get some fresh air.
Thank you very much. No? Thank you very much. So I hope the video was audible and clear from your end. No? But basically, the video talks about the importance of indoor air, no? to the health of the people occupying buildings, no? and structures. So let me proceed with our discussion. I think a similar slide was already shown earlier. Now, this slide shows the risk factors to global deaths. And as you can see here, the number one risk factor to global death, with more than 10 million deaths per year, is hypertension. Second is smoking and high blood sugar. So if you have hypertension, then you smoke, and then you have high blood sugar, you have the first three risk factor for global death. And as you can see, number 4 here is air pollution, both indoor and outdoor, with around 4.9 million deaths. This data is 2017, no? And supporting the earlier presentation, this shows how important indoor and outdoor air quality, no, to human health. Now, what is indoor air quality? No, so simply, when we talk of indoor air quality, we mean the air within and around buildings and structures. So as we learned from the earlier presentation, we are talking here of two types of air quality. The first one is the ambient air. This is the quality of outside air, no, from automobiles, no, from factories, from area source, as mentioned. We have point source of air pollution. Collectively, we call them as ambient air quality. No? And the second very important concern, no, for human health and workers' health is the indoor air. No? And this is especially as it relates to health and comfort of the building occupant. So two important keywords here, no, while we are looking at indoor air quality. Number one is this is the quality of air inside structures in buildings, and another keyword is health and comfort. No? So very important keywords to remember when we talk of air quality. Now, if you look at the literature, there are lots of studies showing the potential impact of indoor air pollution to human health. Now, in this one particular study published by Environmental Research in Public Health, this is one of the most recent that I've seen in the literature. No? This was published April this year, no? A few months ago. And the major finding here is that indoor air pollution is a serious threat to human health, no? Causing millions of deaths each year. So, as mentioned earlier, no, when we go back to the basic principles of ecology, indoor air is actually proportional to the degree of human development also. No? Not only the outdoor air, because in a particular structure, if there are no major sources of indoor air pollution, the indoor air quality is very much influenced, no, by the ambient air quality, no, by the quality of air outside. So I will not dwell so much on this article, no, but just to show you that there are tons of literature, no, from research on indoor air, outdoor air quality vis-a-vis human health and workers' health. And we can really see a lot of studies. No, in fact, as I was preparing this material, no, I collected several studies. No, but in the interest of time, I just would like to mention that we have so much, no, so much study, especially now that we are experiencing this pandemic. No, one major finding in one study, no, that I came across, no, is that the particulate matter, this was mentioned by Clean Air Asia earlier, the PM10 and PM2.5, no? When we say PM2.5 and PM10, the subscript 2.5 and 10 is the aerodynamic diameter of the particle in terms of microns. No? So PM2.5 is 2.5 microns. And one of the recent studies and findings that the coronavirus, the COVID-19 virus, can actually ride, so to speak, no, can attach the virus can attach to PM10 and actually increase the possibility of transmission within areas that are occupied by people. No? So, for example, in one area where PM10 is high, and there are potential, whether it's symptomatic or asymptomatic person, the possibility of transmitting this would actually increase in terms of lateral distance, no? Because the virus can actually ride, so to speak, no, can ride on the particle and can be blown away by the wind to a further distance. So these studies now being published, similar studies like this, no, and I'm sure that in the near future we'll be reading from the literature similar studies linking air pollution to COVID-19, no, and other health-related diseases. Now, what is acceptable indoor air? No? When we talk of acceptable indoor air, this is air in which there are no known contaminants or harmful concentrations, and which a substantial majority, no, about 80% of the people exposed do not express dissatisfaction. So in your respective workplace, it's also important to get feedback of the workers. It's very important to perhaps do a small survey within your organization with regard to the experiences of the people, no, in working in your respective areas. And sometimes it's important to designate the area, no, because, for example, in one building, there are areas that are high risk to air pollution. Not all areas of the building, no. So, for example, those areas that are near the, say the the power supply, no, those workers working in the maintenance section, or for example in hospital setting, those workers in the wards, no, has higher risk vis-a-vis those workers working in the offices, no? So we have to take note also of the specific location where these workers are located, no? And their potential exposure and satisfaction, and also their feedback, no, in terms of whether they are satisfied or not satisfied with the indoor conditions, no, that is perhaps secondary to indoor air quality. Now, why should we be concerned about indoor air pollution? So I think the earlier presentation also mentioned this, no, but just to add, to put additional emphasis on this, we all know that in urban areas, people spend more than about 75 to 90% of the time indoors, right? So unlike in the rural areas, no, where the farmers can spend maybe 8 hours to 10 hours a day working in the open air, no? But our condition in urban areas that we have no choice, no. For example, at this time, no, we cannot have this webinar outside. We have to go inside the building. So in reality,
Tanong nyo kay Kuya Aldwin.
for
PH.
for
Pero, PH
for urban
33,
areas,
yung gagawin niya, pero PHB talaga siya.
Can you hear a lady talking into the phone? Can you please turn off your mic?
thank you so much. It's a good way to break the monotony. Yeah, and aside from that, no, aside from about 90% of the time spending indoors, no, in urban areas, many air pollutants known to be hazardous to health are also emitted indoors, no. Very simple example here is the cigarette smoke, no. So for those of you who are smoking, please take note. And then indoor environments trap pollutants, and levels may be 2 to 5 times higher than the outside. So this is one reality, no, in terms of the influence of outdoor air quality to indoor air, no? Because of the structure, there is a possibility to accumulate, no. There is a cumulative potential for the pollutants outside to accumulate inside. In one of the study, one of our faculty members, no, in the College of Public Health, he studied the indoor air quality in one of the biggest hospitals in Metro Manila, no? And one of the findings is that the pollution outside, no, the ambient air quality influence significantly, no, the quality of air inside the facility. Okay. And the quality of indoor offices and other workplaces is important, no, not only for workers' comfort, no, but as we were saying, even in the first presentation, is that the health is a very important factor here. Now, potential sources of indoor air pollution. One is the HVAC. No, HVAC is the ventilation, heating, ventilation, and air conditioning system. The HVAC system can actually accumulate molds, bacteria, and carbon monoxide when these facilities are not properly maintained. The restrooms, no, can accumulate molds and fungi if not properly, if sanitation practices, no, and housekeeping practices are insufficient. Furniture and carpets, no, that can emit formaldehyde, organic solvents, or even asbestos to some extent. But right now, as all of us know, asbestos is now banned. No? So in your establishment, if you still have furniture or finishing or heat-proofing material made of asbestos, it should be removed immediately. No? Because asbestos is a class 1 carcinogen. No? It can cause mesothelioma or lung cancer. Other sources of indoor air pollution in offices, very common, yung mga office machines, no, chemicals, photocopiers, no, and other office equipment that can emit indoor air pollutants. Okay, so just to add, no, the indoor air can be contaminated both by chemicals, no, chemical contaminants, as well as biological contaminants. No? And for the chemical contaminants, we have volatile organic compounds, no, for cleaning agents, no. Sometimes for pest control, no. Pest control is very important, no, in buildings, no. I know that some of your buildings have regular pest control using insecticides, no. So proper precautionary measures and safety measures should be observed, no? Because the active ingredient of the pesticide or insecticide can stay, no, in the building. So there can be some ventilation measures, no, to ventilate excess pesticide, or in some instances you can implement administrative control, no. By what I mean by administrative control is that you can schedule it. For example, one very simple administrative control is you schedule the application of this pesticide during the weekend, no? So that on the next 2 days, there will be no exposure, no, as far as the workers are concerned, no? And of course, carbon dioxide, as shown in the video. Another study, no, I don't want to dwell on this so much, but I think I mentioned this already, no, the role of particulate matter in the spread and increase of COVID-19 morbidity and mortality. Also, most recent publication, no, published within this year. Now, according to the World Health Organization, a well-maintained and operated heating, ventilation, and air conditioning system can reduce the spread of COVID-19 in indoor spaces by increasing the rate of air change. So a little later, let's talk about air change, no? Because air change is a very important factor in the transmission of diseases, no, including COVID-19 inside workplaces, no. And again, WHO mentioned that recirculation modes, no, which recirculate the air, should not be used, no, especially now that according to Karma earlier, no, because of the improving conditions, our quarantine status is a little bit opening, no, and people start to go out, no, and work. And as far as the heating, ventilation, and air conditioning system, it might be important to to remember, no, that as much as possible, we would like to uh, we would like to minimize recirculation of air, no? Because this can actually increase the likelihood, no, of COVID-19.
Sorry, Dr. Molina, 2 more minutes, please.
I thank you so much. Thank you for that reminder. And then for the heating, ventilation, and air conditioning system, uh, I think this is straightforward. No, we have to regularly inspect, maintain, and clean. So preventive maintenance for the HVAC system is very important, no, in terms of minimizing the impacts of indoor air quality. Okay, now very quickly on the sick building syndrome. This is an old phenomenon, no, that was first observed in the 1970s, where a set of symptoms associated with time spent in building were observed. So take note that the symptoms is associated with time spent. So if we spend longer, the symptoms are more defined, no, and symptoms such as respiratory tract irritation, skin irritation, headache, dizziness, and others were observed. And it was also observed, no, that symptoms diminish or cease, no, when occupants leave the building. So this was a very important observation during that time. Although the symptoms cannot be traced, no, to a specific pollutants or source within the building. Now, these are based on studies. No, these are possible sources, no, of sick building syndrome inside the structures, printers and photocopiers, no, that produce ozone. So it's important that you look the location of your printers and other equipment should be strategically placed, in such a way that it will minimize exposure, or that the location should be accessible to some form of exhaust ventilation in order to capture the pollutants and thereby direct them outside the building. There are also biological pollutants, EMF, now from computers, and of course, inadequate ventilation or defective HVAC. Control measures include, of course, very practical, proper sanitation, proper maintenance, cleanliness, no smoking in the workplace. Very important is IEC. IEC is information, education, and communication. So the workers are actually co-responsible, not only the management. No, the workers are also responsible for their health. So a very good IEC for this purpose is in place. And for the guidelines, I would like to refer the group to different sources, no, for guidelines for public safety in the new normal. The WHO has different guidelines on this. Even the Department of Labor and Employment in our university, we have also guidelines for the workplace vis-a-vis the prevention and control of COVID-19. Finally, for monitoring air quality, let me just go back a little bit because this is very important. The air changes per hour is actually is a measure of air volume added to or removed from a space in 1 hour. So in other words, air change per hour is a measure of how many times the air within a defined space is replaced per hour. And look at the recommendations here, no? For light commercial offices, business office, I think is quite relevant to most of our participants. The air change per hour should be 6 to 8 times. No, this means that the entire air volume, no, inside the room, no, or the office should be changed 8 times per hour. And this should be computed based on the capacity of the HVAC, no, yung heating, ventilation, and air conditioning system. This can be done, no, and the recommendation is 6 to 8 air changes per hour in order to minimize, no, risk associated with indoor air quality. And finally, I think that's all for the moment. Thank you very much for your understanding. I'm sorry if um, maybe my audio is not very clear now, but at this point, I would like to end my presentation, and I'd be very happy to listen to your comments and perhaps answer some of your queries with regard to the presentation. Maraming salamat po. Thank you so much.
Thank you, Dr. Molina. We could hear your presentation very clearly and also all the roosters in your backyard.
I'm sorry. I'm sorry for that, Karma. No,
No problem, no problem. I mean, it's actually it's nice, at least for me. And I'm sorry to some of our audience who were asking. Sorry, we could not mute the rooster. Chris wanted to mute everybody else, but the rooster, unfortunately, it's beyond our control. So in the meantime, we have received a lot of questions. Dr. Molina, maybe we can address some of them now, and I think some of them we could go on to later because we have more specific presentation in terms of monitoring devices and equipment and what's available in the market. So perhaps we could discuss those kind of topics later. So we have this first question which I would like to pose to you, Dr. Molina. It's from Walter Maranan. I'm not sure what the acronym stands for, but DOLE OSHC, suspended indoor air quality testing. If we wanted to go back to the office, how can we make sure that there is no high accumulation of VOC, formaldehyde, carbon monoxide, RH, and other indoor pollutants? That's a very important question. Would you have something to say on that, Dr. Molina?
Yeah, thank you so much for the question. Thank you, Karma. Before I answer the question, let me just mention that the noise of the chicken and rooster is part of indoor air pollution. You were disturbed a little bit, no? But anyway, thank you for the question. DOL is the Department of Labor and Employment, and the question is, since the indoor air monitoring is suspended, how can we be sure, no, that when we go back to our respective offices, the quality of air inside is okay? Did I get the question right?
Yes. So
Okay.
if that indoor air quality testing has been suspended, then how else would you know what is the level of VOC and all these pollutants indoors?
Okay. The second option that we have now, if we cannot measure the indoor air pollution by way of using instruments, no, if there are problems with instrumentation, the second way is to ventilate the workplaces prior to entrance of the workers. No? So aside from ventilation, perhaps a very good housekeeping measure is actually in order. No? So proper cleaning, perhaps if there are carpets, it should be vacuum first. No? And uh, if the space is, or the area is closed for several months, no, perhaps 2 days prior to the start of the work, the areas should be properly ventilated and properly cleaned. No? So perhaps that's the second option. But of course, the best way is to know the levels by way of measuring. So after some time now, when DOLE is now available, I also suggest to push through with the measurements.
Right. Thank you, Dr. Molina. So that is like the other option, huh? Just to open up the windows and air the office.
Yes, please.
So I think this is more of a comment from Vilet Kamara. Managing your indoor air quality means understanding the air quality factors in relation to your occupants and their habits. Smart indoor air quality monitoring devices can help you with this. So indeed, thank you for this comment, Lilith.
Thank you. Thank you for the comment.
Very true. And I think there are a lot of quality monitoring devices. In fact, there is a question on this, so we can talk a bit more about this as we go along. And then this question is from Bulgan, from our team, from ADB. So you have these two scientific studies. Would it be possible to share a copy of these studies to all participants? So we will request for a copy of these studies or the web link, Dr. Molina, and also for everybody's information to the participants. We will be preparing a web page, with the web recording of this training, together with all the presentations and the reference materials. So including these articles that Dr. Molina had referred to. So we will be sharing the web link with everybody after the webinar.
Yes, Karma. We'll do
Yeah,
that.
thank you. So, and then there is another question on from Floro Francisco. How about indoor air pollution in basement parking and also in the car? So I think that is also another important one, particularly in the context of Manila, because we do keep the car in the basement, and sometimes when you're in line to get a parking lot, you spend like some time, right, waiting in line. So you have anything to say on that, Dr. Molina?
Yeah, thank you, Karma, for the question. That's a very important question also for indoor air in parking lot, especially if the parking lot is located in the basement. No? Because basement parking would uh, normally lack proper exhaust ventilation, no, because of the location. So one of the measures that is very important is to remind patrons, no, that they have to turn off the engine of their cars upon parking, because if there are some patrons who sometimes some members of the vehicle, no, some passengers would remain inside, and while the aircon is turned on, no, and the engine is running, no, and one of the very critical pollutants, no, that can be released is carbon monoxide. No, carbon monoxide is very deadly. Carbon monoxide has 20 times more affinity to blood hemoglobin. So a person can actually die, no, if exposed to significant levels of carbon monoxide. And another issue with basement parking is that there is if a possibility of carbon monoxide accumulation, especially if the ventilation is not sufficient. Now, why? Because carbon monoxide is heavier than air. So in a quiescent condition, I would like to repeat, no, in a quiescent condition with no very good ventilation, if there are engines running in the parking lot, uh, the carbon monoxide can settle down at the breathing zone of a person, because it will displace air. Now, to give you an example, like if you mix water with oil, oil is water is heavier than water, right? So after some time, after mixing oil and water, after a few minutes, you will see water on the lower portion and oil in the upper part. So this is the condition that happens in a parking lot, no? Where carbon monoxide is heavier, so it will displace oxygen, no? It will displace oxygen. So that's why a person can die of asphyxiation. So we can discuss this in a more detailed, but perhaps some other forum, no, can
Right.
yeah. But as of now, I would like to mention that. Thank you for the question.
Thank you, Dr. Molina. So there is another question on, okay, I'm going to just select a few because I think these other questions will be relevant even for our other speakers to respond to later. But this one, there is a question from Francisco Palma. Dr. Molina, do we have any study so far on how indoor air affects work efficiency and how it can be monitored? Do you know if there are any studies on this?
Yes, please. No, there are. And in fact, one of the major determinants of occupational health is actually indoor air quality. So, if you can just browse through the literature, you can see studies linking indoor air quality to workers' efficiency, effectiveness. No, and in fact, in my earlier presentation, I should have presented something on carbon dioxide. No? But yes, no, just to answer the question, yes, there are studies, no, and there are certain uh, indoor air quality parameters that can be linked to efficiency, no, and productivity of the workers. Thank you.
Mhm. Yes, and in relation to this question is mainly got to do with UP. Is UP open to carry out research or a study using indoor air quality monitoring device? Is
Yes, thank
perhaps UP is already doing it?
Yes, thank you so much. Actually, we are doing, we call it WEM. WEM is WEM, Work Environment Measurement. So we have a small laboratory in the College of Public Health, UP Manila, where I work, the Department of Environmental and Occupational Health. So we have equipment, we have sampling equipment and a laboratory to analyze. But as of now, we only respond for companies on a first come basis, because we also use this equipment for the students. No? And as of now, sorry to say this, no, our laboratory is not that big. No? So, but if in the future you can go to our website, no, and then you can connect with our department, or you can connect with me, no, so that I can assist you if you need a WEM. No, WEM again is WEM, Work Environment Measurement. Thank you.
Right. Okay, thank you, Dr. Molina. So I think last question before we move on to our next speaker. There are a lot of questions, but just letting the audience know, we will come back to those questions later because I think it's relevant for other speakers as well. The last question, Dr. Molina, how do we introduce fresh air if the default setup of the aircon system is recirculation? What we are recommending now is opening of windows, even if ACs are running. So what can be done about this situation, Dr. Molina?
Thank you so much. So perhaps you can check this problem with your HVAC technicians, no, in your respective companies, because I think there are some HVAC now that can actually extract air from outside, no. But if not, uh, the other way is to provide exhaust ventilation, no, exhaust ventilation, because opening the air is relying on the natural ventilation. That's also okay, but sometimes in bigger space you need a mechanical exhaust ventilation, no. And the location also is important, no, because as we know, used air or hot air is on the part of the stratum, no, and cool air is on the lower part. So you can discuss this with your uh, HVAC technician of your building, and if the natural ventilation is okay, meaning that the room is not very big, that's fine. That's fine. But you have to compute for the possible air changes that I discussed earlier. No, air changes is the number of times you change the total volume of air in the building per hour. So it can be computed, no? It can be computed, no? So don't worry. What you're doing is okay, no? But what I would like to recommend is you check it out whether uh, opening windows is already enough, no? Otherwise, you have to add additional exhaust ventilation. Okay. So thank you so much.
Okay, thank you, Dr. Molina. Thank you so much. Maybe we will bring you back later to address some of the questions, but for now, I think we should move on to our next speaker.
Thank you so much.
Thank you, Dr. Molina. Now I would like to invite our next speaker from Ateneo de Manila University, Dr. Jemin Luis Apostol. His nickname is Jello. So Dr. Jello is a physician, professor, and researcher specializing in environmental public health, climate resilient health systems, and socio-ecological determinants of health. He has been supporting the government in policy making and public health programming. Dr. Apostol's environmental health team has also conducted research on the following fronts: air pollution health risk assessments, for ambient air quality and special events, such as the recent Tal volcano that we had here, volcano eruption in January, linkages between health and waste management, solid waste, healthcare waste, COVID-19 waste, health and biodiversity management, impacts of plastic pollution on health, to ensure that research is effectively translated to better policies and programs. Dr. Apostol also serves actively as a scientific expert for the Philippine Interagency Committee on Environmental Health, where he helps convene various government and non-government agencies, civil society, and other sectoral representatives towards developing better policies and programs for pollution control and public health promotion. So there are many more nice things to say about Dr. Apostol, but in the interest of time, I have just highlighted a few things. So Dr. Jello, I hand over the floor to you now.
Thank you very much, Karma. And I just wanted to confirm whether my screen is sharing properly. Are
Yes.
you able to see the full screen? Okay, thank you very much for that. And again, good afternoon, everyone. I'm Dr. Jello Apostol from the Environmental Health Unit of the Ateneo School of Medicine and Public Health, which is really just a stone throw away from ADB. And I am pleased to be sharing with you some of the latest and evolving science on the transmission of SARS-CoV-2, which is the infectious agent of COVID-19. A lot of what I'll be presenting has also been presented and are currently being looked into by the Sub-Technical Working Group on Data Analytics of the Interagency Task Force, or IATF, on Emerging Infectious Diseases, where we also currently serve as a technical consultant through our organization, ThinkWell LLC. I guess also just to re-emphasize what Dr. Molina has said earlier in this lecture, is that the discussion on the transmission and prevention science around COVID-19 is becoming more and more important now, more than ever, especially as countries, including ours, transition to reopening our economies and our communities under the new normal. A lot of the new normal minimum health standards that we are currently developing at the IATF and by other parallel units in other countries are predicated on our understanding of how COVID-19 is being spread from one person to the next and under different settings and conditions. And among these conditions that we're currently looking at, and it's of particular interest, not only to reopening the economy, but also for other sectors, such as education and tourism, will be discussions and evidence around the transmission and prevention of COVID-19 in indoor settings, especially as the new normal would actually return or bring people back to these settings that most of these indoor settings that may put them at higher risk of contracting COVID-19. So for this afternoon, and in the time that was given to me, we shall go through the latest evidence that we have curated and also have provided to the IATF, and then zoom in at the main meat of the discussion, which is how exactly is COVID-19 being transmitted indoors, what are implications to indoor air quality, and maybe some recommendations of how we might be able to build back better or build forward better, and maybe answer some of the questions that have been raised in the chat group earlier. But I think before I begin, I'd like to raise some important caveats. The first caveat is that the science that around COVID-19 exposure transmission is still evolving. We are still learning about how the virus spreads and the severity of illness it causes. In fact, over a span of just months and even few weeks, our understanding of transmission has changed from being just purely symptomatic to including asymptomatic transmission, and from being focused on droplet and contact transmission to now including airborne transmission, which we will go through or discuss very briefly later. The other very important caveat, and this really brings to bear the most of the evidence that we have reconciled over the past few months, is that transmission and prevention of COVID-19 is actually multifactorial and not definite. There's no usually there's no single transmission in real life events. A lot of the transmission can be a combination of different exposure and mechanisms. And there are a lot of factors that can be considered from an environmental public health standpoint, everything from the room area to ambient weather to humidity to temperature. A lot of these things do factor in, and most of the science may not necessarily take into consideration these factors, and that's a very important limitation. But nonetheless, this has implications when we do plan forward and when we do plan to build better our institutions and our environments, because we get to realize that there's no single measure that is like a silver bullet that will completely eliminate COVID-19. And what we are really advocating for is for institutions, including business organizations, to adopt an optimal mix of interventions, including environmental interventions, to be able to effectively mitigate and prevent the transmission of COVID-19. So moving on, let's jump into what's the latest on COVID-19 transmission. And really, again, no, I'd like to emphasize that the importance of the different routes of transmission for SARS-CoV-2 is something that we should constantly educate ourselves, because how we will react to and respond to COVID-19 is based on our understanding of this transmission. A lot of the minimum public health standards, such as the 6 feet rule, covering your cough and sneeze, making sure that you wash your hands regularly, are based mostly of our understanding on these transmission routes, particularly around droplet transmission, where the strongest evidence on COVID-19 transmission is. As a respiratory virus, the principal mode by which people are infected with SARS-CoV-2 is through exposure to respiratory droplets carrying the infectious virus. But there are actually different mechanisms and routes. So the first one is through contact transmission, either direct or indirect, such as when you have direct contact with an infectious person, or you do handshake, you touch their infected hands during handshake, or with an article or surface that has been contaminated by infected respiratory droplets, which we also know as fomite transmission. The most where the science is greatest is on droplet transmission, and it's infection that's being spread through exposure to virus-containing respiratory droplets. A lot of the relatively larger droplets and particles exhaled by an infectious person through expiratory activities such as talking, coughing, sneezing, and even just silent breathing can release these droplets laden with infectious viral particles. And for droplet transmission, transmission is most likely to occur when the person is close to the infectious person, particularly about 6 feet, which a lot of evidence really points to. That's the current evidence for the distance for droplet transmission, not only for SARS-CoV-2 but also for previous pandemics and outbreaks for flu and SARS-CoV-1. The last one, and this is really the latest when it comes to the science or understanding of the science around COVID-19 transmission, is this possibility of airborne transmission. And airborne transmission is infection spread through exposure of virus-containing respiratory droplets. But these are relatively smaller droplets as compared to the usual droplet transmission that was described earlier. And because we are dealing with relatively smaller droplets, these relatively smaller droplets have a property of being persistent or staying in the ambient air for a much longer period of time and traveling at much farther distance compared to the relatively heavier and much larger droplets. So this usually where a lot of the confusion is between droplet and airborne transmission, especially even in public health circles. We do not have some standards when it comes to the size differentiation between these relatively larger droplets and these relatively smaller droplets, which we also call aerosols. So it must be noted, and I think I'd like to emphasize at this point, that while we do have different routes of transmission, these modes of transmission are not mutually exclusive. Usually when you are in a real world environment, it can happen that droplet transmission can coincide with contact transmission and can coincide with even airborne transmission, especially under specific circumstances that we will be discussing later on. But really, so over the past few months, a lot of our standards and responses have been predicated on droplet transmission. The 6 feet rule, how droplets, relatively large droplets, are able to travel up to a distance of 6 feet, and usually beyond that, because they're relatively heavy, they can fall down. But bringing into the table this possibility of airborne transmission, as recently released by the WHO, after having denied it for a number of weeks and months, finally they gave in to state that there is a possibility, citing certain outbreak reports, which we can also go through later, that have suggested the possibility of aerosol transmission. And this really just emphasizes the diagram on your right, really goes to show the epidemiologic and transmission implications of introducing an airborne transmission component to a disease that we usually or originally thought of as purely being transmitted through droplets and contacts. Precisely because if we introduce that airborne transmission component, we do recognize that the virus can stay on the air for a much longer period of time. So that's persistence, and can travel for much farther periods. So if you remember right now, CDC and DOH and IATF currently defines close contact as being in contact with someone for around 6 feet for 15 minutes or more. But those standards were predicated on an understanding of a disease that's primarily transmitted by droplets. But now that we know that it can be transmitted through airborne transmission, we might have to rethink these standards, which we will be discussing later. But suffice to say, and this is really just to get the doubts and hesitations and have them addressed, is that we do have available and growing evidence on airborne transmission of SARS-CoV-2 through aerosols. It's not universally accepted up until now. If you take note of the WHO declaration, you can still sense a bit of hesitation, which really just shows that there's still no universal acceptance, but there is evidence. We do have multiple scientific journals. These are some of the documents, researches that we have been curating for the IATF over the past few months, especially in deciding and developing policies, evidence-based policies on reopening economies and the business sector. And it's there. A lot of these are peer-reviewed, and they cover everything from epidemiologic evidence, from case reports to cross-sectional studies and case control studies, to even physical aerodynamic measurements of aerosols and modeling. So the evidence is there. But again, if you notice, I will have a lot of caveats in this presentation. We still stand that it remains that the current known, when it comes to the prevalent epidemiologic knowledge for SARS-CoV-2 transmission, that most infections are still spread through close contact. But I guess we are not removing the possibility, and it can happen. Airborne transmission can happen. And if you allow me to just pick up or cherry pick some of the studies, and a lot of these are oftenly quoted and even used by CDC and WHO in developing their guidelines. One of the more commonly cited ones is the study among bus riders in Eastern China, where they've noted that even with passengers sitting more than 2 meters or 3 meters away from the index case, in the absence of other confounding factors, transmission was made possible in an enclosed bus space. Another often cited study, again, if this presentation will be shared, these are hyperlinks that will allow you to visit the actual studies for your reference and further convenient reading. But another study, another oftenly cited study is that in Washington, in Skagit Country, Washington, where they noted that during a choir practice that was attended by 61 persons, the symptomatic index patient actually eventually infected 32 others, which resulted in 3 hospitalizations and 2 deaths. And what they found out, considering all other factors that they could have considered, is that it was facilitated by close proximity, which we already know, but this time it was also augmented by the act of singing. So the activity, more than just the space, now becomes also an important consideration. So there's actually so much more evidence, and I'm more than happy to be able to lead and handhold you through understanding all of those evidence that we are currently reviewing at the sub-PWG, IATF sub-PWG on data analytics. But just to summarize, okay, airborne transmission, we have established earlier that airborne transmission, though relatively not as common and prevalent as droplet and contact transmission, can happen. And it can happen under certain circumstances. So we do identify 3 circumstances, also bringing to bear some of the researches that were earlier mentioned. So it can happen in enclosed spaces within which an infectious person either exposed susceptible people at the same time, or which susceptible people were exposed shortly after the infectious person may had left and introduced droplets that persisted in that enclosed space. The second mechanism is prolonged exposure to respiratory particles. And usually this is encountered in healthcare settings. We do talk about aerosol generating procedures, but if there's something that we learned from the Skagit country study in Washington, it can also be made possible by other, non-healthcare activities such as singing, shouting, exercising. This one becomes a very important concern, especially for the BPO industry and other industries that require a lot of talking. And the last one is inadequate ventilation, or spaces with inadequate ventilation. The University of Nebraska Medical Center also has a good summary. It's a bit different, but they identify 3 V's. I think this is a very useful, simple framework that businesses can adapt, especially when identifying high-risk conditions. I always say to some of our partners in the business sector that it may not be possible for businesses to identify whether the room that they enter into may be contaminated with SARS-CoV-2. But it is possible for you to identify whether the room that you enter into is high risk or not, and can facilitate or makes airborne transmission more possible. So you talk about a conducive venue, enclosed with a lot of people indoors, poor ventilation, and activities that include a lot of vocalization. Japan has a parallel, so UNMC has the 3 V's. Japan has the 3 C's. They talk about crowded places, close contact settings, and confined and enclosed spaces. So how then do we build forward better? And I'm really down to my last few slides, but I'm happy to answer more questions later. What are some current agreements on COVID-19 prevention in indoor spaces? So now we're becoming very specific, especially as we zoom in to this whole issue of how do we safely bring back our employees, our people, our communities to all of these indoor spaces of activity, from schooling to tourism to business and work. So at least at the level of the IATF, what has been presented and what's currently being reviewed is that existing interventions to prevent the spread of SARS-CoV-2 appear sufficient, especially when we talk about universal masking, when we talk about maintaining physical distancing, although that physical distancing part might have to be revisited, especially for certain high-risk areas. That 6 feet rule must be revisited. But all other interventions, such as frequent hand washing and universal masking, seem to or appear to be sufficient when it comes to addressing or making sure that we prevent transmission in indoor spaces. Now, this whole question on how can we intervene when it comes to ventilation or even some engineering controls, there is this recognition that when accompanied by social distancing, and other minimum public health standards such as use of masks, hand hygiene, surface cleaning, ventilation, and avoidance of crowded indoor spaces can help in mitigating transmission of the SARS-CoV-2 virus. And later on, we can discuss further on this. Based on our current understanding of how prevalent or how highly possible and widespread airborne transmission is, at this time there is no indication of a general need to be using specialized engineering controls to mitigate airborne transmission of COVID-19. What are these specialized engineering controls? We talk about negative air pressure rooms, we talk about HEPA filters. A lot of these are being used in the healthcare setting, and they're definitely warranted in isolation rooms, in ICUs, in healthcare settings. But at least based on the evidence that we have right now, there is no indication for the need to be investing or using these specialized engineering and specialized engineering controls. Let's just go through the 3 V's that we've mentioned earlier. Now, as we enter the 8th or 9th month into pandemic, it's high time that we start refining some of the minimum public health standards that we are adapting. Right now, we have very gross minimum public health standards: 6 feet, wash your hands, wear any masks. But at least when it comes to physical distancing.
Sorry, Dr. Jello, 2 more minutes,
Yes,
please.
yes, I'll go very quickly. Now, knowing that the odds of catching COVID-19 are 18.7 times higher than in open air environments, we need to be looking at all of these factors that render indoor environments to more risky, that render them with higher risk of transmitting the SARS-CoV-2 virus through multiple routes of transmission, not just airborne transmission. There's an interesting study by Bazant and Bush. I think this is a preprint which is currently being peer reviewed, but it makes a good case for now, especially for a lot of the indoor spaces that we have for working and for schooling. Just the 6 feet rule, and even as supported by other minimum public health standards, will not be sufficient, especially from protecting populations from airborne transmission, especially if people will be staying in these enclosed spaces for prolonged periods of time. So when it comes to building back better and planning better, we just need to be, the key point here is it's not just physical distancing that we should be worried about. We should be contextualizing and refining our setting standards to take into consideration things such as room volume, ventilation capacity. Dr. Molina mentioned earlier air recirculation and exchange rates, and the expected activity as discussed by some of the evidence that we had presented earlier. Some ventilation considerations, this was mentioned earlier, that ventilation and filtration can play a role. But again, a very important caveat is that by themselves, they will not work as a silver bullet in preventing airborne transmission or any other type of transmission of SARS-CoV-2. Ventilation is also very important because now a very important mechanism for mitigation mechanism for companies is to make their disinfection of their offices more frequent, but that might also create secondary hazards. So where ventilation and interventions when it comes to ventilation and filtering can come in, so that not only are people protected from the hazard that is the SARS-CoV-2 virus, but also from the secondary hazards from the more frequent use of cleaning products and disinfectants. These are some general strategies. I'm more than happy to discuss this given more time, but the WHO and CDC actually encourages natural ventilation instead of mechanical ventilation whenever possible. But we do know that this may not be feasible for many business settings, especially in Ortigas. A lot of them are quite dependent on mechanical ventilation. Not all would have adequate number of windows, and we would be needing more windows for more people expected to come into a room. We must minimize recirculating air, just to emphasize the point that was made by Dr. Molina earlier. Right now, the IATF is considering an air exchange rate of around 4 to 6 times per hour as a minimum public health standard. This is, subject for further discussion with other business sector representatives and experts. Increased ventilation, very important that we get to identify high-risk areas, high-traffic areas, and make sure that these are more ventilated than lower-risk areas. And we'd like to encourage avoiding mixing air between high-risk and low-risk rooms. Your HVAC systems can actually be modified. Some HVAC systems can actually be modified to create negative pressure or inward-directed airflow. Especially in areas of higher risk for contamination and aerosol generation, such as bathrooms. And there is a possibility of being able to supplement these ventilation interventions with other infection controls, such as mentioned earlier, local exhaust, high efficiency air filtration. So you have your MERV 13 filters or high efficiency filters that you can actually be installing in your available ventilation systems. And even supporting this with germicidal ultraviolet lights. There's also a lot of evidence on the efficacy of UV in deactivating the SARS-CoV-2 virus. Um, Recommendations that's also currently being reviewed and hopefully adopted by the IATF would be the ones coming from the American Society for Heating, Refrigerating, and Air Conditioning Engineers, where they actually discourage disabling your ventilating and AC systems, because this might produce greater problems, especially exposing people to heat-related problems, especially in areas that are quite dependent for these systems in cooling their office environments. And heat-related diseases are linked with cardiovascular diseases such as strokes. So we do not want to be creating more problems. There's this very good discussion on designing your ventilation systems, whether you'd opt for displacement or mixing ventilation systems. And in general, most of the studies are pointing towards greater efficacy of displacement ventilation systems as compared to mixing ventilation systems. So implications on vocal activities. Here, very important that we would like to emphasize compliance to universal masking, even in indoor spaces, and to limit vocal activities. And maybe opt for barrier controls, especially in areas where people will really have to talk more regularly and vigorously. And from an environmental standpoint, we'd like to affirm the WHO directive that for general public use, we don't need to be using medical surgical masks, because not only are these single use, but we do have eco-friendly options such as reusable cloth masks that afford the same efficacy as medical grade surgical masks for general public use. But then again, a caveat here is there will be certain activities in your company or in your organization that will be considered high risk, and in those cases, more medical grade masks might be warranted. So I hope, Karma, you can give me a minute just to have these concluding remarks. I just want to say that
a lot of questions waiting for you.
It's not really as black and white as indoor is better than outdoor. Okay, neither indoors nor outdoors is universally safe. You can have an indoor with a small number of people and a good ventilation, and that will be a low risk environment. Or you can have an outdoor environment where people have a high disregard of minimum public health standards. Like we can talk about the Trump rallies, and then all of these public outdoor events that had disregarded minimum public health standards, and that does not make it less risk than indoor environments. And an earlier point made earlier is that because we do know now that it's likely that not just one kind of transmission can happen, but a mix of transmission mechanisms can happen. Knowing that pushes us or encourages us to pursue an optimal mix of interventions that address all of these possible routes of transmission. Again, also to emphasize that we must not lose sight of other compounding and synchronous risks. It doesn't mean that we have that we have COVID-19 now, that all other problems such as indoor air pollution, sick building syndrome, and other hazards do stop happening. So we do have to opt for integrated risk management. And right now, what we've been learning at the level of the IATF is that there's much to be gained from learning from each other through communities of practice, especially learning from the private sector. A lot of the evidence we've seen, and we do admit that the private sector can be much faster, more agile when it comes to compiling all of these evidence and even testing these out. So we're more than happy to be listening to your preliminary learnings and insights. Again, at this point, we have a progressive pandemic. No one really holds the science, the complete science to everything. And sometimes it's also good to be listening from process owners and end users from the ground, such as you. Here are more questions that we can answer together. Right now, you're working with the WHO and the DOH-ERDD in understanding question number 2. How can existing indoor air quality exacerbate risk for indoor transmission of SARS-CoV-2? Building up on our existing indoor air quality studies. But hopefully, you in the private sector can also help us in answering these questions, which eventually only stand to help make more evidence-based policies that we can implement under the new normal. Again, thank you very much, and thank you for allowing me to extend a bit. Good afternoon.
Thank you, Dr. Jello. Very, very informative. And yeah, we've had in the previous webinars, we've had our speakers say that actually there is no real silver bullet solution. And in general, with not just COVID-19, but in general, like addressing air pollution. So it really is a combination of different factors. And in the meantime, we have accumulated a lot of questions. And I would like to pick on this question, which was already posted earlier, actually, during Dr. Molina's presentation. But I think you can also help to address this because there are a number of people who've asked this on the air purifiers that are available in the market. Do they really work? Can you give some advice on how helpful having an air purifier is inside your room or your building? Can you shed some light, or which one works or which doesn't?
Okay, so really for that, you really have to go back to the specs of your air purifier. But as per the latest guidelines, and this one has also been asked during the IATF meetings, is that, and so far the agreement on air purifiers is that when used properly, air purifiers can help reduce airborne contaminants, including viruses, in a home or even a confined space. However, again, the important caveat there is that by itself, a portable air cleaner is not enough to protect people from COVID-19. It still has to be used along with other best practices, such as hand washing, universal masking. But they can be a part of your plan to protect yourselves, your constituents, your employees. Really, the best effective way is for you to be for improving. When we talk about air purification in indoor settings, the best and most effective way is really source reduction. So you really have to remove the source of impurities. But when it comes to portable air cleaners, a lot of them are usually designed to filter the air in a single room or area. So again, you have to go back to the specs of your air purifier. You have to look at the type of filter that's being used. And you have to take note of, based on the specs and the filters that are embedded in your air purifier or your portable air cleaner, which type of pollutants can it actually purify. But there are some models, although we do recognize that some of these more efficient and effective models may not be as widely available in our country yet. But we'd like to listen more to what the private sector thinks about the availability of these technologies. Usually, we are impervious to the availability of these technologies, and
Right.
we'd love to hear how accessible these technologies are, or how accessible they can be made for the general population.
Is somebody else speaking? So actually, while we're talking about technology, Walter Maranan, he says that there is a brand, and I'm wondering if I can invite Walter to ask this question about the plasma air bipolar ionization. Walter, would you like to speak up and tell us a little bit more about your question on this particular technology?
Hi, good afternoon, Karma.
Yes, good afternoon. So maybe we can invite you to ask a question, actually.
Yeah, I know of a brand. The brand is Plasma Air, and the technology is bipolar ionization. And they have a lab test of COVID-19 surrogate virus, which is MS2. They said that it is identical in terms of structure with COVID-19. And the test says it was done in Spain by the Ministry of Defense. It was signed by them. It says that it eliminates 99% of the airborne viruses and 80% of surface virus. I have a copy of the result. If you want, I can provide you with a copy.
Mm-hmm.
You can share it with everyone if you want.
And to add to that, Walter, the Department of Health is actually open to reviewing a lot of these interventions before the IATF or any of the agencies are allowed to recommend any intervention. At least for health technologies, they have to undergo a health technology assessment. And the HTAC Council of the Department of Health is very much open to receiving a lot of these recommendations from private sector participants, such as you, especially if you may have any leads about technologies that can be adapted in the new normal. Thank you.
Yeah, actually, I know the company who's a distributor of this. The name of the company is Indoor Air Quality Philippines. I know the owner also. Who exactly the person that they should talk to regarding the study? I think it will help if it really proven that it can eliminate 99% of airborne viruses.
Mm-hmm.
Yeah.
Thank you for that question, Walter. Another question, I think this is with regard to this from Julian Rodriguez. Maybe Julian, can I also invite you since so that we can have a little bit more interaction with the participants on your question on studies on COVID-19 as aerosols and its occurrence are documented. Julian, can I invite you to ask a question? Okay. If he's not going to ask, then I will.
Hello.
Yes.
Yeah,
Hello.
sorry. Yeah, just wanted to ask if there's some evidence that COVID-19 being an aerosol is occurring here in the Philippines, and if it is or not, what are the factors that make COVID-19 an aerosol?
Okay, so when it comes, as per the latest sub-TWG meeting on data analytics, we haven't really, we don't have in our hands right now any local studies on aerosol transmission, but we do have a wealth of studies on aerosol transmission. A lot of these peer-reviewed and also being referred to by the WHO, CDC, and other parallel health ministries and other countries on aerosol transmission and airborne transmission and airborne transmission. Still, we do acknowledge, as mentioned earlier, there's no universal acceptance of airborne transmission. But just because we do have significant amount of evidence, that I think, a personal judgment on my end, is that is sufficient evidence enough to allow us to reconsider and revisit a lot of the response and mitigation mechanisms that we have identified, knowing or being cognizant of this new transmission dynamics. And as to your second question, we've identified earlier some of these conditions that make people or that make certain settings at higher risk for facilitating airborne transmission. We talk about enclosed spaces, we talk with a high occupancy rate and people spending more time in these enclosed spaces. We talk about, so that's the first V. The second V on ventilation. We talk about areas with poor ventilation, especially with high recirculation and poor air exchange. And lastly, will be certain activities, particularly activities that require a lot of vocalization. That's the third V. So there are certain industries that come to mind. We talk about the BPO sector, for example, which involves a lot of talking, maybe some in the hospitality industry, which also includes a lot of talking. So we go the 3V, the 3Vs is a very simple framework that a lot of businesses can adapt. Japan has the 3Cs. Those are high risk conditions that make airborne transmission more likely.
Mm-hmm. At this point, actually, may I suggest that we take a short break, a 5-minute break? I do see there are a lot of questions, but we do have more time later after, because we have 2 more presentations and these are on actual sort of case studies. So I thought we should go back to the questions later on. So for now, may I suggest that we take a 5-minute break since everybody has been sitting around for some time. We can go stretch our legs a bit. And if we can be back here by, actually it's 3:54. So perhaps 6 minutes. So perhaps 4 p.m. if we can rejoin.
Thank you, Karma. Thank you very much.
So let's get on with the next presentation that we have. So next one, we get to hear from our own colleague from ADB. So we have Erwin Kasaklang. He is the Senior Facility Planning and Management Officer in ADB. He is currently handling the implementation and maintenance requirements of ADB's integrated energy, environment, health, and safety management system, including greenhouse gas emission inventory and green building certification. He's been with ADB since 2010. And he has been working on the establishment of the energy management system, the ADB headquarters green building certification and recertification. So this is with the LEED certification. And a lot of other ISO certifications for the ADB headquarter building. He has a bachelor's degree in mechanical engineering from De La Salle University and postgraduate studies in environmental engineering from the University of Philippines. So our second person from the University of Philippines today, our second resource person. And he has over 15 years of experience in various management systems and standards. With regard to ISO and occupational health and safety. So Erwin, may I pass over the floor to you now for your presentation?
Thank you, Karma. Let me just share my screen. Please let me know if you're able to see the screen.
Yes, we can see you.
Not the screen.
Not yet.
Yes, everything turned black for me actually.
Okay, it's starting. We can see your screen now, Erwin.
Okay.
Can you put it in presentation mode? We're seeing your.
Oh, you're seeing.
We're seeing your notes.
Okay, sorry about that. Let me just get this one correctly. There?
Yes, perfect. Thank you.
Okay, so good afternoon, everyone. First of all, I'd like to thank Karma and her team in organizing this webinar, targeted webinar for our Ortigas Center colleagues, and also from our government relations, Emily and her team for co-organizing this one. So it is a privilege to share some of our ADB practices within the community. So let me start by providing some background on what ADB is doing and why are we having all these sustainability efforts within the headquarters. So ADB envisions a prosperous and inclusive, resilient, and sustainable Asia and Pacific, while we do our efforts in eradicating extreme poverty in the region. And some of the operational priorities of ADB includes climate change and making cities more livable. Back in 2002, when ADB released its environment policy, now we call it the Safeguards Policy, ADB started working on a sustainability journey with ISO 14001 and OSHAS 18001 through the implementation of a environment and health and safety management system. So while we're pursuing mission in reducing poverty in the region, ADB demands of high standards in its clients to ensure that the development goes hand in hand with sustainability. And for us to be really effective, ADB has to set an example, and that has to begin at home here in the headquarters. So you can see here, one of our policy statements is to strive to eliminate any health and safety risk associated with our building operations, affecting the personnel, visitors, and even surrounding communities through the use of different technologies, disaster plans, recovery plans, and being prepared for emergencies. we have from our fellow panelists with this afternoon, they were able to discuss how air pollution affects us, the environment, and also the economy. So in a 2018 study by WHO, Philippines is affected, the third highest in the world in terms of related deaths for every 100,000 people related to air pollution. Some of the environmental impacts of air pollution was mentioned earlier. It's about global warming, climate change, acid rain, smog coming from industry and urban activities. It affects species, extinction of species through the changes in ocean temperatures, disruption in migratory cycles, disruption also in crop cycles, and even the composition of the food that we eat. For the urban environment, air pollution accelerates deterioration of our building materials. And yeah, it is really affecting our economy. There are reports coming from Greenpeace Southeast Asia that air pollution links about 4.5 million deaths with PM 2.5 pollution, and about 1.8 billion days of work absences, 4 million cases of child asthma, and 2 million preterm births. So those are some of the impacts of air pollution. So what do we do with air pollution? How do we manage it here in the headquarters? We have approached this using the hierarchy of controls. You were able to see this slide in Dr. Jello's presentation. And it follows a hierarchy of controls. Elimination is the best one, and that is the most effective one for managing air pollution. So any type of risk actually can use this hierarchy for addressing or managing the hazard. So you completely eliminate the risk or the exposure to the hazard, or you replace the hazard with a less hazardous process, product, or service. You isolate through the engineering controls. You affect behaviors of the people through administrative controls. And the least effective would be the PPEs that we are being required now. So masks, face shields, some of the examples that we are doing for COVID-19. So it was mentioned about sources during the presentation of Ms. Glinda from Clean Air Asia. What are the sources of air pollution? So in ADB, we have identified some of them. It comes from paints. It comes from our cleaning chemicals, even the roller shades, the furniture, the carpet, the pesticides that we use. Of course, there are still dust, smoke, vehicle emissions coming from outside, coming in the ADB headquarters. So these are typical sources of pollution in an office setting. So we will be discussing in the next couple of slides, we'll be discussing some of the strategies that we are using for managing air quality management here in the headquarters. So one of the strategies of ADB is to bring in nature in the 6.5 hectare compound. We have about 8,600 square meters of landscaping being maintained in the headquarters. And while ADB is situated right beside EDSA, a major thoroughfare, we are expecting to have lots of pollution coming from the vehicle emissions. And the full-grown trees that we have in the west part of the ADB headquarters helps in buffering all this pollution coming from EDSA. We have about 430 tree species, trees, and 27 species of trees within ADB headquarters. And this is not just for buffering or filtering some of the air pollutants, but it also helps in heat island effect. And also a new study undertaken by research in Wollongong reveals that people living in urban areas with more green cover had better mental health, physical health, as compared to those that didn't. So specifically in urban areas, they have a lower risk of developing psychological stress and better overall health. So we're trying to bring in nature as much as possible within the headquarters, not just the exterior, but also we bring them in the facility. So this is one of the strategies that we do for managing outdoor pollution. So when we go inside, we try to manage also the pollutant coming from outside by having this green building strategies coming from our lead operations and maintenance certification. When we started with the green building certification way back 2010, these are some of the simple, practical ways of getting building strategies for air quality management. Having entryway mats at least 10 feet of length along the direction of the travel will help in capturing those particulates from your shoes coming inside. So that's one way. Another is when we started with the no smoking policy within the headquarters way back 2011. The first thing that we did was to have a demarcation line about 25 feet away from all building entrances. So those for ADB staff who are with ADB since 2011, you will know that the central courtyard was really a smoking area for us. But then we were promoting green building strategies, and one of the priorities would be environmental tobacco smoke control. So we had demarcations 25 feet away from all building entrances. Then we built a smoking lounge. We still have a smoking lounge currently, but it's not being used. That's part of the strategy for ensuring that we are having minimum standards, especially this pandemic. There's still a study being conducted by our space team on what to do with this smoking lounge. But for now, we are retaining it, but it's not being operated. So in terms of chemical management, some of the chemicals that we use for cleaning are also provides us with the pollutants. Having cleaning chemicals preferably with eco-labels like Green Seal, those standards help in providing chemicals with less VOCs, less pollutants in the building. And part of the green cleaning would be having specific cleaning procedures, having specific schedules for each of the areas that we've identified. Now they have expanded this cleaning in terms of not just cleaning, but also sanitizing. So every 30 minutes that our housekeeping custodians are doing some sanitation on high-touch areas as part of COVID protocols. Another one would be our integrated pest management. So once we introduce integrated pest management, it sees that everyone has a role in this program. It's not just the pest control company. The building occupants need to clean up. They also have their role, clean up after eating, keeping your food in appropriate containers. You have your snacks, you have your meriendas. That's typical of Filipinos. We encourage them to also help out in the integrated pest management because they also have their own. Also for building maintenance, having proper controls within barriers, for example, open spaces wherein you can have pests coming in and out and really having their home in that area. So it's also a big part of building maintenance work in terms of pest management. Again, housekeeping, food services, stewarding, each one has a role in integrated pest management. And part of ADB's program also is about chemical management, that we do review chemicals. We request for safety data sheet. We review chemicals and we approve them prior to use in ADB headquarters. So those are some of the quality management strategies for having the chemicals inside. Another area wherein it will help is really eliminating pollutants, having material specifications in the designs. I know we have our design team present here. They are following some of these material specifications which addresses indoor air, like certified Green Guard indoor air for roller shades, Carpet and Rug Institute Green Label Plus compliance for indoor air quality, furniture with following the standards of business, or BIFMA, which is Business and Institutional Furniture Manufacturers Association.
Sorry, Erwin, if you can, two more minutes, please.
Yeah, okay.
Thank you.
And then we also have programs offering this paints and coatings for Green Seal. Moving forward, we have in our operations, it was mentioned that, okay, air pollution also provides health and also comfort. The HQ office temperature and humidity are providing some thermal comfort requirements recommended by ASHRAE, maintaining it about 24 to 25 degrees Celsius and relative humidity of ±5. This is based on ASHRAE standards, and we are using this as a basis for operating our building systems. In terms of construction or alteration, as your building ages, some of the facilities need to be upgraded, redesigned. Space usage may change, adjusting to the business needs and changing circumstances. So these alterations, constructions are unavoidable, but you can manage this so that it won't introduce or create more pollution inside the building. So some of the strategies is work containment, enclosures, having portable exhaust blowers, shutdown of the building, of building ventilation systems, having walk-off mats, floor covers, cleaning procedures like don't sweep it, vacuum it. Also for small works, there's also a work scheduling that can help out in providing this, preventing impact to during the office hours. So outside, you do the construction outside of office hours, and also you can conduct air flush out prior to occupancy. The Green Building Standard requests or provides a standard of 14,000 cubic feet per minute per square foot of area to be introduced to the facility, and while maintaining a 24 degrees and 60% relative humidity. So that addresses VOCs, that addresses particulate matters. Aside from flush out, aside from building operations, we also do some real-time monitoring. We do have CO2 monitors in all our fan rooms. For meeting and conference room, we have about 100 plus units for CO2 monitoring. This is typically in our new building, the third atrium building, which has a control function. So when the CO2 rises above 1,000 ppm, then a demand control ventilation will introduce fresh air to the room and puts it down below 1,000 ppm. So there's a control function in having this CO2 monitoring. Someone mentioned about parking. We do have monitors for CO or carbon monoxide. We have about 14 units of monitors for carbon monoxide. And we maintain about an 8 ppm standard for carbon monoxide in parking spaces. We also do, aside from the real-time monitoring, it's fixed. We also have a portable air quality monitors which can monitor CO2, CO, PM10, PM2.5, and VOC. CO2 we maintain at 1,000 ppm, carbon monoxide in offices at 90 ppm, PM10 at 0.15 milligram per cubic meter for 24 hours, and PM2.5 is 0.035 milligram per cubic meter, and VOC of about 640 parts per billion. So that would be our standard in headquarters. So next slide would be our management strategies when we started opening up in June. So there are several discussions with our operations team. It's been led by our operations team, and we were supporting checking for standards like coming from ASHRAE or the European standards for ventilation. And there are some recommendations that we were following. You would see here, pre-COVID, we were using already MERV 13 in our filtration systems. And we moved to a higher filtration, MERV 15 currently. The outdoor air supply was intermittent before COVID, and now it's continuous and extended operations. Air purging is being done weekly before COVID. Now it's being done daily with 2 hours daily for about 3 floors. And also when we started, before opening up the ADB headquarters, we did a whole building flush out prior to reoccupancy following the 14,000 cubic feet per minute per square foot of area. And in terms of recirculation, our operations team, our engineering team, were able to adjust all our fan power units to remove the recirculation within the floor level. So from the floor, it goes to the air handling unit and then filtered further before it's being reintroduced to the floors, to the offices. So these are some of the technical, the results of the technical meetings with our operations team. And it's working fine. Of course, we need to adjust based on the current standards. If there are new studies, if there are new guidelines being requested from us, then we'll have to reevaluate and also do some adjustments in our operations. I was mentioning about some of the controls that we have. Those can have, there can be slip-ups, there can be breakdowns in those processes, there can be non-compliances to operating procedures. But what we do in ADB is we use those standards, and we use the standards and managed by a system. So we are implementing a management system following a Plan, Do, Check Act, wherein we are able to learn from our mistakes. We have corrective and preventive actions. We address impacts or risks immediately. And that's how we sustain the activities that we do for air quality management, as well as other initiatives that we have in the headquarters. So having those industry standards, having the management system, use those standards, it all contributes to a sustainable headquarters. To end, it was mentioned by Glinda that some similar quote, but I'd like to end with this. Man can live 40 days without food, 3 days without water, maybe 8 minutes without air, but only 1 second without hope. So I'd like to end this presentation with this quote, as I think this is very appropriate and needed while we are still in the midst of this pandemic. So thank you very much, and stay safe.
Thank you, Erwin. Apologies if you cannot see my video because my computer is doing something strange. So I am surviving with hope at the moment that my computer will not crash on me again as it did 12 minutes earlier. But thankfully, I can still hear you, and I believe you can still hear me. So thank you very much, Erwin, for your presentation. There are a few questions for you, but I think we should move on to Jack's presentation. and then we come back to have the final round of Q&A. I would like to invite Jack, our next speaker. Apologies, Jack, that you had to wait so long and you're there in Australia. I know you are like 3 hours ahead of us. So sorry for the long wait, but I think what you will have to inform us and the participants is very, very important information. Jack Noonan is the Vice President of the Asia Pacific International Well Building Institute. So he's responsible for the Asia Pacific branch of this organization. He's based in Melbourne, Australia. Jack's role involves leading the technical support, market development, and operations across Australia, New Zealand, and most recently Southeast Asia. And he will talk a little bit more about that. Before he joined the International Well Building Institute, Jack was the manager of climate change programs at Sustainability Victoria, which is a government agency where he developed and led the Take 2 climate change program and informed state climate policy. Jack has worked with several organizations, local and state governments in Australia on healthy building design and practices with a focus on indoor environment. He has a master's degree focused on commercialization of science and emerging technology. In 2009, he was a winner of the National Australia Bank Science in Business Award. So his area of expertise includes air and water quality, healthy buildings, sustainability rating tools, science commercialization, and climate policy. And he is a well-accredited professional and a member of the International Society for Indoor Air Quality. So Jack, you are our last speaker, but not the least. I hand the floor over to you, Jack.
Thank you so much, Karma, and thank you everyone for joining this afternoon. It is a real privilege to be able to present to you here from Melbourne. I'm sorry that I can't be in the Philippines presenting to you in person, but I hope everybody is keeping safe and keeping healthy and keeping well. I'm actually quite inspired by, I've really enjoyed the presentations so far. I think that all of the presentations are very pertinent to what I will be talking to you about today. But particularly I want to commend Erwin and the work that ADB is doing. Many of the interventions that Erwin spoke about are interventions that are within the well building standard and are important interventions in the context of well health safety, which I'll be talking about today. I'm just gonna. So you've already heard from me, but this is me. You've already heard my introduction, I should say. I'm based in Melbourne, but provide support across Asia Pacific, including supporting a number of projects that are pursuing well certification across the Philippines, which is very exciting for us. The team that I work for is an organization called the International Well Building Institute. We're a team that's headquartered in New York City in the US, but we now have staff across 7 different countries. And that includes a team based in China that supports part of Asia, and then also a team that I lead here in Australia that also supports part of Asia Pacific as well. We've got a very, very clear mission at the International Well Building Institute. What we're really striving to do is helping people thrive through better buildings. And when we talk about better buildings, what we're really focused on is healthier buildings. We're focused on healthier people, stronger communities, a thriving planet, because we recognize that planetary health and human health are inextricably linked. And also really creating revolutionary organizations. So organizations that can deal with the pandemics of the future or the challenges of the future. The term sick building syndrome is something that has come up a number of times over the last couple of hours. I started my career as a building scientist, and when I started my career, I was being brought into buildings that were sick buildings. These were buildings that were causing people harm. They were people were getting itchy eyes, runny noses, because of the environmental conditions within buildings. it's still important that we think about sick building syndrome and this idea of sick buildings. But what we're really trying to do at the International Well Building Institute is we're trying to flip that narrative. If we spend so much time indoors, if the physical and social environment is the #1 determinant of our health, it's very important that we just don't focus on creating less bad, but we actually create environments that help people thrive. That's an important distinction. We can't just be focusing on doing less bad. We need to be focusing on doing more good as well. If one thing that a pandemic has taught us is that we can create better buildings, and better buildings that aren't just suitable for a pandemic, that will have benefits moving forward as well. So that's the whole mission of the International Well Building Institute. Globally, we're an organization that is growing very, very rapidly. Currently, we have almost 5,000 projects, 5,000 buildings across the world in 64 different countries. And this encompasses more than 65 million square meters of space that is either well certified or pursuing well certification. Importantly, we also have almost 14,000 people in the well community that are either well accredited professionals or registered to take the exam. And I'm really excited to hear in the prep call yesterday that Erwin is one of these people that has signed up to take the well accredited professional exam. And this represents a community across 96 different countries. The International Well Building Institute was only formed in late 2014. So to see this level of interest, to see this level of uptake in such a short period of time is very, very significant. The way that we really try to transform the market is through a framework or a standard setting approach. We do this through a number of different programs. So we have well certification. I don't have time to talk about the ins and outs of well certification, but well certification is really a very holistic, comprehensive approach about what a healthy building really should be. I'm happy to provide some additional information following this presentation about well certification. We have a professional accreditation for individuals, which is the Well AP. We have a membership program. We have a program for organizations that have portfolios of buildings. And then we also have a new program called the Well Health Safety Rating, which I'll be speaking about in more detail today. I was really inspired by Dr. Jello's use of a number of studies from Dr. Lydia Marasca, who has really been campaigning around the idea that airborne transmission is in fact occurring. In fact, I was one of 850 professionals from across 30 different countries that signed a petition to the World Health Organization to say that the World Health Organization needed to reconsider their position on airborne transmission. But really importantly, something that Dr. Joseph Allen, who heads up the Harvard T.H. Chan School of Public Health at Harvard, he also happens to be a co-chair at the IWI Special Task Force on Coronavirus. Back in late January, potentially even February, he said, if managed poorly, buildings can spread disease, but if we get it right, we can enlist our schools, our offices, and our homes in this fight. And I think what his words 6-9 months ago are very, very profound now, because we know that the physical environment is having a huge impact on our response to this particular pandemic. I should say that in relation to the COVID-19 pandemic, there were a number of interventions that were already existed within the well certification framework that are important in terms of the COVID-19 response. I've listed some of these here as it relates to reducing indoor air quality issues, particularly as it relates to adequate filtration and adequate ventilation. One thing that Dr. Joseph Allen often says is, in his opinion, we are underventilating many of our buildings. Almost all of our buildings, he says, are underventilated. So here are some of the key interventions as it relates to improving indoor air quality from the well building standard. We have ventilation effectiveness, whether or not you're meeting the code in relation to, when I say the code, I'm referencing ASHRAE here, whether or not you're providing enough fresh air into your spaces. enhanced ventilation, whether or not you are going above and beyond those requirements by increasing the ventilation to by 30% or 60%, particularly with an emphasis on the levels of parts per million of CO2 that are often used as a proxy for ventilation effectiveness, whether or not you have operable windows, how you are able to use those operable windows. Are those operable windows able to be opened by people that are particularly vulnerable? Who might not, particularly the elderly. If we think about senior living, you know, often the elderly might find it difficult to open a window. What type of mechanisms are in place to be able to facilitate better ventilation? Importantly, one thing that we've seen, and one thing that I was very, very encouraged by Erwin's presentation, is this focus on air filtration. We know, we've heard some of the presentations around SARS-CoV-2 and its attachment to PM2.5. We know that higher grades of air filtration are more efficient at removing PM2.5 particles. So even it might seem small, but a shift of moving from MERV 13, or even in Australia where we often use MERV 8, but moving from MERV 8 to MERV 13 to MERV 15 is really significant in increasing the efficiency of air filtration and removal of PM2.5 particles. Just in relation to the next one, really there are some key interventions that are focused on managing humidity and controlling sources of indoor moisture. And we know that there is an emerging stream of evidence around the relationship between moisture management and humidity control and susceptibility to SARS-CoV-2. So we've got two interventions within the Well Building Standard, moisture management and humidity control, that deal with these particular issues. But one thing that when the COVID-19 pandemic took place, one thing that I guess one of the first things that we did was we launched a special task force, and this included 14 very special co-chairs, including co-chairs that were represented from across Asia Pacific, but 600 public health experts, virologists, government officials, academics, business leaders, architects, et cetera, put their hands up to be part of this special task force. And one of the things that the task force said was that it's all well and good for many of these buildings to have a focus on WELL certification, but there are many buildings across the world that are not able to target full WELL certification. They're not able to go through the potentially long and arduous process of getting WELL certification, particularly in developing countries and particularly for environments that that might not have traditionally pursued WELL certification, so sporting venues or even places of worship. So one of the things that the IWBI task force recommended was a new rating that focused on health and safety, that was something that was focused on operational management and control. So just a couple of months ago, the International Well Building Institute launched what is called the Well Health Safety Rating. And this was really about prioritizing health and safety in a post-COVID-19 world with third-party verification. So this is about an international organization, third-party verifying what you are currently doing, what you plan to do as it relates to health and safety within your organization. As I mentioned, the Well Health Safety Rating is a third-party verified rating. It is evidence-based. It has been developed by our special task force. It's focused on operational policies, maintenance protocols, emergency plans, and stakeholder education. It is not focused on design. It is focused on ongoing operational management of the buildings. If you're interested in design, I would encourage you to think of WELL certification. But if you're particularly interested in acute health and safety risk as it relates to COVID-19, the Well Health Safety Rating is something that you should be considering. Importantly, it's applicable to any facility type. So it was flexible enough to be applied to any facility type. And I'll talk about some examples of how it's being used a little bit later on. It's flexible, it's scalable, so it is being used by organizations across multiple assets. So in some cases, we've got banks or sporting venues that are applying it across hundreds or thousands of different assets. So it is very scalable. It is verified, so it's a third-party verified system. And importantly, it's really accessible. So the cost of achieving the rating is very low. But importantly, one thing that we heard from the task force is that they didn't want something that just focuses on capital expenditure. They wanted something that focuses on how can you verify what we're doing now in terms of an ongoing operational or facility management perspective. Importantly, it's about not only giving confidence to the building managers and the building owners through the third-party verification, but confidence to the occupants. So every health safety rating comes with a seal that can provide confidence to the occupants. It covers 5 key themes, which I'll touch on very, very briefly right now. So the 5 key themes are cleaning and sanitization procedures, emergency preparedness programs, health services resources, air and water quality management, and stakeholder engagement and communication. I'll touch on each of these very, very quickly. So cleaning and sanitization procedures, what are we looking at here? We're looking at how the organization or how the building supports hand washing, how they can reduce surface contact by creating an inventory of high touch surfaces, how they can improve cleaning practices, how often are certain surfaces cleaned, and how can you select preferred cleaning products. One thing that is often misunderstood with SARS-CoV-2 is that the actual virus itself is not particularly resilient. It can be cleaned using very, very basic cleaning products. But unfortunately, many organizations are bringing in very, very toxic chemicals within their spaces, and it's creating a new indoor air quality issue. So it's really important to get that balance right. In terms of emergency preparedness programs, it's important that organizations have an emergency preparedness plan. One other aspect of this is a business continuity plan. I often reference that one day, many of us were working in an office, and the next day we were all forced to work from home. How is the organization supporting business continuity? Through the provision of laptops, through the provision of monitors, through the provision of keyboards. Is there some sort of continuity for when an emergency takes place? Is there a plan for healthy re-entry? And are you providing emergency resources and bolstering emergency resilience during an emergency? In terms of health services resources, which is the third bucket, this is really about whether or not an organization provides sick leave, whether or not they provide health benefits, whether or not they support mental health recovery. Unfortunately, many countries are reporting huge mental health issues as a result of lockdowns and as a result of this pandemic. We know that there's a strong relationship between flu vaccinations and SARS-CoV-2, and a healthy immune system is really important. So whether or not your organization provides flu vaccinations. And finally, a smoke-free environment. So we know that there are significant comorbidities associated with smoking and the incidence of SARS-CoV-2. Something that I think is very important to this discussion is around air and water quality management. This is not so much about designing or making significant improvements to the air and water quality systems, but really understanding what your systems are capable of. So in terms of ventilation, we're not requiring organizations to significantly increase their ventilation, but what we want organizations to do is to assess their ventilation systems so that they know whether or not increasing the ventilation is possible for them. Similarly, assessing and maintaining air treatment systems. There have been many, many questions around air purification systems as an example. Unfortunately, many organizations don't even know whether or not their system can what their HVAC design is like, let alone, wanting to add additional plant and equipment to that system. So it's really important to understand where you currently are at. Similarly, monitoring air and water quality. You can't manage what you don't measure. So it's really important that organizations are monitoring air quality. because you can't make improvements. You don't, you know, there was a question earlier on in terms of going back to the office. How do we know if it's safe to go back to the office, or a question like that? You really need to monitor the air quality to understand what your situation is like. Finally, the last bucket is stakeholder engagement and communication. This is really about having a team that promotes health and wellness of the project and having responsibilities within that team. And for certain projects, there is also the requirement to share food inspection information. Really, something that's very important, I've outlined 22 different health interventions as part of the Well Health Safety Rating. Projects do not need to achieve all 22 to get the Well Health Safety Rating. You choose 15 of the 22 that I've mentioned, and if you're able to demonstrate compliance with any 15 of the 22, that's how you achieve the Well Health Safety Rating. Just to finish up, I wanted to just quickly talk about some of the global champions that have already pursued the Well Health Safety Rating, including a project in the Philippines, which we're very, very excited about. So the first one is the Empire State Realty Trust, and this was the first commercial office portfolio in the US to achieve the Well Health Safety Rating. You'll see here that the Well Health Safety Rating has a QR code so that organizations, when they come to the building, they can actually use the QR code to understand what health interventions are being applied across that building. This was actually the first health safety rating that was achieved. This was in India. This is RMZ Corp. And they, I believe it was 34 different buildings across India that achieved the Well Health Safety Rating. I'm moving through these very, very quickly because I am conscious of time. One of the most iconic sporting stadiums in the world, New York Yankees Stadium, was very, very public about their commitment and their achievement of the Well Health Safety Rating. This was featured on Fox Sports, on MSNBC in the US, and it was very, very public because there was a lot of interest in fans getting back to sporting stadiums. And I'm not sure if it's similar in the Philippines, but in many parts of the world, sporting stadiums are currently still you know, sport is taking place, but there are no fans. So this is really something about instilling confidence with fans when they do return back to the stadium. Carrier, this is an organization that was the first Well Health Safety Rating project in China. And this followed a very strong commitment to making sure that when individuals return back to work, that they felt safe and they felt comfortable within this particular environment. Finally, I wanted to talk about Monaco Development Corporation and Monaco Tower. I'm sure that many of you are familiar with this particular project. This project was the first project in Southeast Asia to achieve LEED Gold and WELL Gold certification. Not only that, as soon as the Well Health Safety Rating was launched, Monaco Development Corporation decided to pursue the Well Health Safety Rating as well. And they achieved that. They're the first project in Southeast Asia to achieve that. And it came from the Philippines, which we're very, very proud of. Finally, co-working. And this is one thing that I wanted to just mention. I know that co-working is getting a lot of attention as it relates to the COVID-19 pandemic at the moment, but we're seeing more and more co-working spaces pursue the Well Health Safety Rating as well. That basically concludes my presentation. There was plenty of information that I could have presented, but I'm very grateful for the other presenters to have spoken a lot about airborne transmission and things that I'm very, very passionate about in healthy building design. So I feel like I didn't need to cover all of that. But some next steps, if you are interested, you can subscribe for Well Updates. We have a very comprehensive webcast program that is completely free. It is you can attend those webcasts on demand, so you don't need to attend them live. There are some excellent presentations by Dr. Joe Allen as part of that webcast series. If you're interested in healthy building design, if you're interested in healthy building practices, I would encourage you to have a look at those webcasts. We have articles from a wide range of experts across the world. And if you're interested, you can also join our membership program as well. That concludes my presentation. It's been lovely to speak to you all, and I'm happy to take questions and connect with you all offline via LinkedIn or Twitter or via email. Thank you.
Thank you, Jack. Thank you. Excellent presentation. And it's great to know that WELL is also already working in the Philippines. I'm sure a lot of our participants are eager to know more. And we have a couple of questions for you already. But before I begin the Q&A, I'm conscious of the time, and it looks like we may need to go over time for a couple of more minutes, maybe 10 minutes or so. I hope that's okay with everybody, with our speakers and participants. Apologies because we lost time with all these tech issues, and I was also responsible for that. So I hope that's okay. Jack, so the question is from Ronaldo Sabella. Are the WELL standards free or paid documentation? Is it similar to ISO standard? That's one question. And the other one is, what are the practices in WELL certificate buildings that buildings without these certificates? So basically, if a building is not WELL certified, what else can it do to become WELL certified? So if
two great questions. So the first question, the WELL building standard is freely available on the wellcertified.com website. To achieve the certification, there is a cost associated with achieving the certification, but the standard and the framework is freely available. In terms of the difference between a WELL certified building and a non-WELL certified building, and I didn't go into the details of WELL certification during the presentation. It was more focused on WELL health safety rating. But one of the key aspects of WELL certification is that there's an on-site performance test. So there is an independent party that comes to your building and measures the air quality, the water quality, the lighting, the acoustics, and the thermal comfort of your building. This is an independent test. It scares some projects, I must admit, because it can be a quite stressful part of the process. The fact that you've got an independent person to come out to do that test. But that's one of the key aspects of WELL certification. It's all well and good to say that you are designing a healthy building, but is that healthy building actually performing? Is that building performing as the design intended? Unfortunately, you can't answer that question unless you're measuring. Unless you're measuring the air quality, you're measuring the water quality, you're asking the occupants what they think about the building as well. That's something that we often miss as part of this conversation. Data is incredibly important, but qualitative data in terms of occupant experience is also very important. So that's the key difference between WELL certification and a building that is just using the practices of healthy building design without targeting WELL certification. I hope that answers the question.
Yes, I think it does. And yes, I fully agree that it's very important to be able to monitor, actually, to be able to measure. It's not just kind of saying it, but you also need to have the evidence through the data. So two more questions. I think it's connected. Whether WELL has certified any government buildings, and whether you also cover the, I guess, certification of commercial buildings, sorry, not just commercial buildings, but also whether you certify schools, house of worship, residential buildings.
Yeah, so the answer to that is yes. We currently have over 400 projects that are residential projects that are targeting WELL certification, most of which are actually taking place across Asia Pacific, which is very exciting. I often say that particularly in Asia, the drivers around a healthy building are far more pronounced than in other parts of the world, because air quality issues are a major concern. And the drivers of WELL certification and the healthy building movement in Asia are really people who are occupying the spaces. They're people that want healthier environments for their families, and that's why we've seen such a significant uptake in the residential sector. We do have a number of projects internationally that are government buildings, that are government projects. I don't believe that we have any government projects in the Philippines yet, but we do have government projects here in Australia. We've got probably at least 20 different projects that are being led by government here in Australia. And we've got a number of government projects in China, in the United Kingdom and in the US as well. So we're seeing significant uptake from the government sector as well. I can't remember what the first part of the question is, but I think it was places of worship.
Yes,
in schools. So yes, we are seeing significant uptake in schools, particularly in the US, when you've got case numbers as high as 80,000 COVID-19 cases per day, and schools are reopening. Healthy building design and practices and operational practices are a huge concern for schools at the moment. So we are doing a lot of work in schools. Dr. Joe Allen, who I've referenced a couple of times, has provided an amazing resource in relation to schools. We've also got on the Well Certified website, we've got free COVID-19 training for teachers. So I think it's an hour training session for teachers who are going back into the classroom and want to understand how they should mitigate the risk within the classroom. So that's a great resource. It's freely available to teachers. Even if you're not a teacher but you're interested, you can take that training as well.
Mm-hmm. Excellent. Thank you, Jack. I'm sure a lot of our participants will be looking up the Well website now after this webinar. If I could turn to Erwin, because there was a question for you as well, Erwin. This is from our colleague Bulgan about whether ADB has air pollution monitoring devices for ambient and indoor air quality. Can you please provide some, whether pollutants are being measured and what's being done in ADB?
For monitoring devices, we do have monitoring devices for carbon dioxide and carbon monoxide. Those are fixed installations, but we do have a portable ones that we can use for some of the rooms. So we do random sampling of the various areas in the building. For ambient air pollution, that's still in the works. When we did that in last year, we had Clean Air Asia and SDCC working with us on having a temporary installations for outdoor air monitoring that took some interest from our management that okay, that's a good project, but we would like to package it now as looking into smart buildings. So not just the outdoor air quality, but also how you relate it to indoor air quality and how those monitoring equipment can help in controlling the environment within the headquarters building. So we do have monitors, but we would like to extend that to a wider scope or wider coverage and get some monitoring devices that are fixed and have capabilities for monitoring other parameters such as PM10, PM2.5, and VOCs.
Mm-hmm. Thank you, Erwin. So actually, Bulgan and myself and a couple of us in our division, we are looking to increase the scope of ADB's work in monitoring air quality. And we are currently managing a TA, and hopefully we can get some funds to procure more equipment for ambient air quality monitoring, hopefully sometime next year, because this year a lot of our funds got diverted to COVID-19.
Yeah, that would be really helpful. I was in contact initially with Virinder, and he relayed to me that you're the ones leading this air quality management, and so yes, we hope to work with you on this.
Yes, so we will also touch base with you on that.
Yes.
Now going back to, so we have Jack from Well, and then we know that you have been working on LEED, like ADB is a LEED certified building. This is personally from me, actually. I'm just curious. So what is the difference between the two?
Great question, and a question that I get very, very often, given that I come from a sustainability background. LEED and typical green building rating systems really focus on environmental sustainability, and they touch on things like indoor environment quality and social sustainability, whereas WELL certification focuses on social and health and well-being sustainability and touches on environmental sustainability. What that might seem like, it might seem like it's quite duplicative, that they're the same. They're very, very different. There is probably, I would say, about a 10 to 15% overlap between LEED and WELL, or Green Star and WELL, or Green Mark and WELL. There's about a 10 to 15% overlap. That overlap is generally focused around lighting and acoustics, I would say. But what WELL really does is it takes the concepts around health and well-being that might already be in LEED and expands on it much further. Looks at policy intervention. So, you know, LEED might say, you know, do you have storage for bike facilities, as an example? Do you provide active facilities? Whereas WELL will say, do you have active facilities, but what policy is in place to encourage people to ride to work? It will take it to the next level. So that's the difference between the two rating tools. One thing that I would say is that if you are pursuing both certifications, we have a wide range of resources to make sure that you are not duplicating effort or duplicating documentation, that if you're getting something approved in one certification that is deemed equivalent, you don't need to provide any additional information. You just, that it's already approved. So we work very, very closely with the green building councils across the world.
I see. Okay, thank you. So actually, again, while you're still on the screen, Jack, this is a question again from our colleague Bulgan. Since you're from Australia, what is the situation on policy enforcement in monitoring indoor air quality?
It's a great question, because I think this is starting to change. But in Australia, we take indoor air quality for granted. We take air quality more generally for granted, because typically in our history, we've had great ambient air quality, and we think that that means that we've got great indoor air quality, which is not the case. We've heard from all the presentations that we're introducing things in our space that is compromising indoor air quality. Similarly, many of the participants today would have seen the pretty devastating bushfires in Australia at the start of this year, and also would have seen the wildfires in California just last month. So what we know is that our ambient air quality is changing. We know that that the ambient air quality is changing, and that is affecting our indoor air quality as well. So unfortunately, to this point, there has not been any consistent policy enforcement around indoor air quality in Australia. But we're hopeful that that will start to change as a result of both the bushfire season that we had at the start of the year, but also the COVID-19 pandemic. So we're really hoping that a lot of this work will shift from being a voluntary based market mechanism to something that is embedded within legislation. One of our key roles at the International Well Building Institute is around market transformation. And when we talk about market transformation, a lot of people might roll their eyes and say, well, what is market transformation? We want the measurement of indoor air quality to be the norm. It shouldn't be just for the high-end buildings or the best buildings across the world. Measuring indoor air quality should be for every building, similar to what we have with energy at the moment. It's almost ludicrous to suggest that a facility manager doesn't understand how their energy is being managed in their buildings in 2020. Whereas 20 years ago, many facility managers wouldn't know the answer to that question. What we want is the same answers to be answered for, the same questions to be answered for indoor air quality. And we really feel like as an organization, we can start to shift the market towards that.
Mm-hmm. Right. Thank you, Jack. So last question, Erwin. I think that's for you. From Justin Galang, can we get the contact for the monitoring equipment? I think that's the equipment that ADB is using for indoor air quality monitoring.
Maybe just to clarify, is it the indoor air quality or the outdoor air quality that we used as a pilot installation last year? Because there's an ambient air quality monitor that we
Maybe
were
we can
using.
invite Justin to ask the question. Justin, if you're still there, would you like to ask the question?
Can you please provide both? We'd like to install or implement a sample or pilot within our barangay hall and as well as for in public places.
Okay. For the one that we use inside the building are the built-in ones are from Siemens. We also use a portable air quality monitor, which is we call a dust track, TSI equipment, and also for the ambient air monitoring, it was from you may want to search a breather from. It's also being used by DNR in Bataan. So I'll just get the actual name and then I can message you separately. Would that be okay, Justin?
That would be perfect, sir. Thank you.
Thank you.
Thank you, Erwin.
If it's helpful, and this is certainly not an endorsement, but a number of indoor air quality monitors that have been used on well-certified projects, I can provide some examples of those if it's helpful. The products that I've seen used on well projects include a product from Kaiterra, spelled K-A-I-T-E-R-R-A. Have got indoor air quality monitors. Also, Omni Aware have indoor air quality monitors, and also an organization called Aircon, which is a New Zealand based manufacturer of indoor air quality equipment. So there are 3 examples that I've seen on well-certified projects, if it's helpful.
Thank you. Thank you. So I think now we are coming to the end. We've already gone over time, and I hope Miss Kathy, if you can please hang in there a few more minutes since you're going to be giving the closing remarks. I'm still
here.
Apologies for the delay.
No
but
problem.
I would really like to invite Marga Christiana, if she's still online, to tell us a little bit more about her social enterprise, Smart Air. I thought it sounded really interesting, that work that you're doing. Marga, are you still online? She probably left because she had mentioned that she's from Smart Air and we're a social enterprise. And one of our mission is to educate about the harms of air pollution. And we've been doing this since 2017. It's free. We also teach people how to create their own do-it-yourself air purifiers. So yeah, I think Marga has left the webinar. So she.
Hi, Karma.
Yes, hello.
Hi, this is Lirio Waldring, and I am a colleague of Marga Reginaldo. And we represent Smart Air here in the Philippines. So just a brief introduction on what we do. We are a social enterprise, and we have been educating people from different institutions even before the pandemic happens. And, we explain to them the harmful effects of air pollution, whether they're indoors or outdoors. And we teach them simple solutions that they can do to protect their health, our health, from this invisible killer. So examples are, we teach them the importance of plants, indoor plants, good ventilation. We even teach them how to make their own DIY or do-it-yourself air purifiers, because we believe not a lot of people couldn't afford to buy one. So that's what we do. And we have been We have been presenting to many groups as well, whether it's schools, hospitals, local government units, and if people invites us, even if it's just through Zoom or Teams, via to Zoom or Teams, we conduct the presentation, and this is like commercial free. We don't promote our products. We even teach people again how to make their own air purifiers, because it's really simple. It's just a fan that will suck dirty air, and it's going to push through a HEPA filter. That's all we need to breathe, at least to help us breathe safer air.
Right. Thank you, Lirio. So can we look up like Smart Air? Do you have a website? How can we get more information?
Okay, that's great. We have a website. It's called smartair.ph, and we posted a lot of data about air quality, about what we can do to protect our health from it, from the invisible killer. And you just have to go to open data, and you will see all the details, that could help us breathe safe.
Okay, great. So we will touch base with you, and maybe we can figure out a way to include the information on the webinar website. Thank you, Lirio, for that information. So I think before I hand over to Kathy, Ms. Kathy, who is the president of OCAI, I would just like to again quickly inform all the participants that have attended the training today that we will be having a website, a web page with the recording of this webinar, all the presentations and the reference materials, such as all the articles that were mentioned by Dr. Molina and even Dr. Jello. So all the materials will be posted on the website, and then we will share the web link with everybody, with all the participants that have attended the training today. And I hope everybody has used their full name to log on today. And it's not a bunch of acronyms and numbers, because we do need to issue certificates to everybody. Our colleague Chris will be helping us with this, and he will be sending the certificates over in a day or two. And so I guess the Q&A session should end here, because we've really gone over time a lot. Apologies for all the technical errors today. And I would really like to thank our panelists and speakers for the excellent presentations. And a lot of, I think there is a lot of information that we have gained, and not only just for building managers, but even for us. Like for me, my concern is when I go to do shopping or to eat in a restaurant, what is it that I need to look out for to know that the building is safe and secure? So I've learned a lot today, and I'm sure our participants have also learned a lot. So thank you very much for the participants. We still have more than 100 participants on board, so you all have hung on a long time. Thank you very much for the active participation. So Ms. Kathy, may I hand over the floor to you to give the closing remarks for the training?
Okay, thank you, Karma, and I guess thank you to everybody else for staying on. Well, first of all, I'd like to thank the Asian Development Bank for spearheading this forum in cooperation with Clean Air Asia and the Ortigas Center Association, Inc. I believe that the members of ABMOSI, which is the Association of Building Managers of Ortigas Center, are here in full force also. So thank you, Director Jean Romero, for the effort. A lot of information today. We heard from researchers, from experts and policymakers who shared their experience, expertise, opinions, and provided new insights on matters related to, I guess, air quality and air pollution, and how these impact us and our publics. So to all our speakers and resource people today, thank you for sharing your time and knowledge with us. Much appreciated, really. Our speakers have brought to light the impact of air quality to our health. To a certain extent, I guess a lot of us have already been made aware of the ill effects of outdoor and indoor air pollution. And yet it seems that efforts to spread the information to society have not been all that encouraging. So I hope that from today's session, our resource people have, I guess, scared us enough to, prompt us into be more proactive. I hope that today's session also will encourage all our participants to help our resource people spread the word. I think in a Clean Air Forum some years back, the theme was one air. So we do indeed breathe only one air, and we all share the air that we breathe. And I think it's our responsibility to our society and to make sure that we help in efforts to keep the air clean inside and outside our buildings. I guess doing so would entail effort, much effort and cost. No, I understand that a lot of the participants here are building managers who do not make the ultimate decision to invest in efforts to guarantee clean air. But perhaps I'd encourage you to maybe share insights from this session and convince the decision makers to make the investments. And you can very well tell them that these investments would be more than justified if it means a continued supply of tenants to their buildings and guaranteeing a cleaner future for our publics and for our families. So once again, thank you to the organizers for providing this venue to share experiences, to provide new insights and study constructive ways to address the continuing challenge of keeping our air clean and dealing with the pandemic and adjusting to the post-pandemic world. We're very glad the OCAI is part of Ortigas Center, which houses also the Asian Development Bank. So we're very lucky to be part of this group. So keep well, everybody, and have a good and safe evening ahead. Thank you.
Thank you, Ms. Kathy. Thank you, everybody. And we in ADB, we are also very grateful to be part of the Ortigas Association.
Yeah, represented by Miss Emily Barber. So thanks, Emily.
Okay, thank you. Thank you, everybody. Wish you a good evening ahead.
All right. Bye.
Thank you.
Bye.
Thank you,
Bye.